I see Anthony there as well. I'd just like to welcome Anthony to the committee.
Thank you very much.
Folks, it's 4 o'clock and I think all the members are here. So I think we'll make a start. So if Karen, if you'd like to read out the notice. So I'll just start by welcoming all the members to the meeting today, and I'd like to welcome Professor Anthony Staines and Professor Helen Dulk, who will be giving us a presentation from the Zero COVID group. So welcome everyone, and as I say, Karen, if you would like to read out the notice there now.
Darren, I'm just not sure. I think Karen might have a connection difficulty there. I'll just give her a call. Sorry, Darren, I got hold of Karen there. I think her screen, everything just frozen, so she's just going to come out and rejoin the meeting.
Okay. You okay there?
Yeah, thank you, Chair. I have been reconnected as such, which is great. So, firstly, members, welcome to this our first meeting of 2021. So, can I start just by reading the summons? Members, you are hereby summoned to attend the virtual meeting of the Health and Community Committee on Thursday, the 14th of January 2021 at 4 p.m. So, the attendance, firstly, Alderman Devaney. Alderman Guy.
Here.
Alderman Wark. Councillor Barr.
Here.
Councillor Burke.
And Shaw.
Councillor Duffy. Councillor Edwards.
Here.
Sorry, and Sharon.
Thank you, Sandra. Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Harkin.
Here.
Councillor Logue. Councillor McHugh.
And Shaw, Karen.
Councillor Mooney. And Councillor Riley.
Here, Karen.
Okay, can I just double check then? Councillor Mooney?
I'm here.
Okay. And Councillor Wark, Alderman Wark,
Here, I'm here, Karen.
and Alderman Devaney.
Here, can Karen hear me?
Karen, I'm here.
Yeah, no, sorry, members, couldn't just hear you all properly there as such. So, no, thank you for that. So that's me complete.
Okay, Karen, thank you. And I'll read out now the statement for remote meetings. I'd like to remind everyone who's in the remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be terminated or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. By participating in this meeting, you're consenting to being filmed and to the use and storage of these images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website. And just a reminder to keep deliberations short, members. And we'll go straight declaration of members' interests. If anyone wants to declare now, just put them in the chat box as we go along. And we'll get straight into it now. So there's a presentation from Zero COVID Group from Professor Anthony Staines of Dublin City University and Professor Helen Dulk of University of Ulster. And I would just like them to take the floor now, and it's all yours.
Thank you very much. Perhaps Helen to start with it, as I think she's prepared a very instructive presentation, and she's more familiar with the situation in Northern Ireland than I am. I think Helen is.
Sorry, I don't have a formal presentation to give because I actually thought that Professor Staines was starting first. But just to tell you what we're all about, we're speaking from the Independent Scientific Advocacy Group. Or Anthony, do you want to start with a general presentation of where we're coming from?
I'll share my screen if that is okay with people. I think I can do that, yeah. I hope you can see my screen at this point. What we're trying to do is to bring our lives back to normal as quickly and as expeditiously as we can. None of you need me to remind you of the awful impact of this virus really on both parts of this island and on the remainder of the United Kingdom. It's been horrendously difficult for us all. I trained in the United Kingdom in medicine and public health, so I know the English system and the Scottish system very well. And obviously I've worked here in the South for the last quite a few years. But our analysis at the moment is that the islands are under severe restrictions, essentially to protect the health service and to reduce the number of cases. And this is something that has happened before. There have been several lockdowns in the south of Ireland and several lockdowns in various parts of the United Kingdom of various degrees of severity and various complexity. And all of these have cases, and all of them, once the restrictions are released, the number of cases rises up again. In the south, we had brought this down to single digits by June of last year. And there was a lengthy discussion as to what to do at that point, and the decision was made to reopen the economy in the Republic. And essentially rose steadily from the day the economy was reopened until we had our second lockdown in October. And we had our second lockdown because we were at nearly 1,000 cases a day. And it was felt our health system would come under serious stress if that continued. We opened up again at about 200 cases a day for Christmas. And I think all the world knows what has happened in the days since Christmas. We're now running at 3,000, 4,000 cases a day. Our health service, which has substantially less capacity than the health service in most parts of the United Kingdom, is creaking at the seams, and we are back in a lockdown. We're asking the government to consider using this lockdown to achieve a number of goals, primarily getting back to normal. The current plan for the government and the Republic is that we will live with the virus. So we will reduce the number of cases to a reasonable number. We will open up again. And as the number of cases rises again, we will subsequently close. And the vaccine will eventually deal with all of this. Now, we have a timescale for vaccine deployment in the Republic, end of September of this year. We have a timetable for vaccine deployment in England and Wales, which is essentially the end of October of this year. I don't have a timetable that I've heard for deployment of the vaccine in Northern Ireland, but it seems likely to be similar to that. So we're talking about the autumn. The problem from a business perspective is that vaccinating even a large proportion of the population does not stop viral spread. We know from work in Brazil, where there is a city slightly larger than Dublin, which had 60% of the population infected with COVID-19. It's the city of Manaus in the Amazon region. And they were writing a paper. They had written a paper saying 60% is enough to suppress infection. And they'd published a draft of the paper when there was another major outbreak. So they rewrote their paper and they said 60% is not enough to prevent a major outbreak. We think it's closer to 80%. And that is the target that virologists, both in the United Kingdom and in the Republic of Ireland, tell us is required. So we need to vaccinate 8 out of every people on the island of Ireland to stop the spread of the virus in our two countries. That's the implication of that is if we do nothing else, we could expect to have 1 or 2 further episodes of lockdown over the course of the spring and the summer. And each of those episodes will be associated with substantial damage to our economy, to tourism, and to people's lives. So we have suggested a number of actions. The first is what we are doing now, which is aggressive suppression. And this is being done on both sides of the border in very slightly different ways. But the idea is to bring the number of cases down, to prevent new cases coming in. And this is very controversial and unfortunately probably very necessary. In the Republic, we had 50,000 people flew in over Christmas, and they contributed to the major outbreak that we are now experiencing. And it has been the experience of every country that has tried to do this, that once you get down to low levels, that enough cases are imported, whatever it is you're trying to do. We want to manage travel within the Republic of Ireland and between the Republic of Ireland and Northern Ireland. And again, this is controversial. but it is possible. We already have significant restrictions on travel between counties, and we're proposing to extend those restrictions along the border. What happens on the Northern Ireland side of the border? A matter for yourselves and for the government in Strabane to decide, not for the Republic, but it's something for you to consider. We need a special arrangement in the border regions where many people live one side of the border and work part-time or full-time on the other side of the border. And that needs to be accommodated. So people who live in towns where the border is on the bridge town need a different arrangement from people who live 40 miles from the border. But that can be done. And we have examples of how this can be done. And we've had discussions with officials, with politicians, with policemen on both sides of the border to assess the feasibility of what we're suggesting. We want to continue with all the work actions, wearing masks, hand hygiene, ventilation, and keep doing it. And that's probably not going to go away until we eliminate the virus. And we've actually been fairly good at that on both sides of the border. There's widespread acceptance, according to opinion poll surveys, of these restrictions, of these changes in behavior, and they're popular. South of the border has been weak. I would think it has been stronger in Northern Ireland than in the Republic. We have failed to do proper contact tracing. We only ask people about their movements for the 48 hours before they present for testing. And in consequence, for many, many people, we don't know where they were infected. Ireland works somewhat better, and we need to get it working properly on our side of the border. Identifying cases, testing cases rapidly, contact tracing, and supported isolation. I'm a public servant, I'm working from home. If I had to go into isolation, my employer would still pay me, and actually I would still be working. But many people are not as... Many people need to be paid to go into isolation because they lose money, which they cannot afford to do. So there is a need for better support for isolation. Regional control we've talked about. At the moment, with very high case numbers, this is essentially irrelevant. But when case numbers get lower on both sides of the border, there were areas where there were very few cases for long periods of time. And there were areas, both Belfast and Dublin being two, where the case numbers never really fell to very low numbers. And we can manage those areas differently. And people can do different things in those areas. And finally, supporting people affected by isolation and by restrictions. The impact of isolation needs to be seriously considered. The mental health impact of the restrictions we have in place needs to be seriously considered. And people need help to cope with it. And that help may mean accommodation during isolation or funding. We have many people who are, for example, carers for a vulnerable adult. If they go into isolation, who is going to care? But they may feel they have to in order to protect the person they're caring for. So all of this has to be considered. All of these practical issues have to be considered. So we have choices on both sides of the border. One is to continue as we have, essentially going in and out of isolation as it is required. The business community are telling us on both sides, we've been talking to the Dublin and Belfast Chambers of Commerce, that this cycling is extremely damaging to business. but the uncertainty is extremely damaging to business. Where we would like to go is to go to the situation they have in New Zealand, where there's very little foreign tourism coming in, or Australia, where there's very few foreign workers coming in. And Australia and imported foreign workers than any part of either the United Kingdom or the Republic of Ireland. But they have coped. They have managed. Australians are taking their holidays at home this year, instead of, as they often do, going to Indonesia or Vietnam on their holidays. They're going in Australia. And we would like people to be planning to take their holidays in Northern Ireland this summer and support our local hospitality industry. But we can only guarantee that if we can restrict the number of cases sharply. It is likely that even after we drive the number of cases to zero, there will be further outbreaks. So, for example, in Australia, as I speak to you, they're investigating an outbreak in Brisbane, and part of Brisbane has been closed. Break 2 weeks ago in part of Sydney, a very wealthy and affluent part of Sydney, and that part of Sydney was closed. But both outbreaks were dealt with by fairly routine, intense but routine public health measures. The New South Wales outbreak seems to be contained, and hopefully the Brisbane outbreak will be contained shortly. But other than that, life is back to normal. 20-something million people in Australia, for 4-something million people in New Zealand, for 70 million people in Vietnam, for about 20 million people in Taiwan, for 1.4 billion people in China. Life is back to normal. Business is back to normal. The economy is back to normal. Jobs have been recovered. Businesses have recovered. And COVID is rapidly becoming an unpleasant memory rather than a living reality as it is for so many countries in Europe. So that's a kind of a summary of our thing.
I can maybe add a few comments. Would you like me to do that, Darren, or do you want to take discussion first? Or
No, well,
I'll go on from there. Yes.
Yep.
Well, I mean to repeat some of what Anthony said, but 3 things we've learned very clearly from last year. One is low virus levels is good for health and good for the economy. I think any suggestion that the two are in opposition is clearly shown not to be the case by what's happened to business by cycling lockdowns. Because we've allowed virus levels to get too high, it means we're in and out of lockdowns. It's not good for health and it's not good for business. So the first thing is that we've got to get them down low and keep them low. And in order to do that, we have to act early. And we have a particular problem in Northern Ireland, I suppose, about, agreeing on the actions and tending to be a bit late. But that's also a problem at the UK level, or tending to be very late. And the third thing is to integrate the health and the economic response. You can't just respond with health measures and restrictions. You have to support financially the businesses and the workers, etc. And that has to be ready, that package. In terms of, what can be done now to help the situation, we're in really, in a really bad state in Northern Ireland in terms of the health service and the pressures on the health service for both COVID cases and non-COVID health conditions, of course. I think one of the things that has been said for months since really the first lockdown is we have a real problem potentially, although not a lot of local data, on isolation. We do all this testing and tracing, but none of it is any use unless people are actually able to isolate for the 10 to 14 days required to stop them transmitting the virus to somebody else. And the evidence UK-wide suggests that many people are not able financially to isolate as required. And in fact, it might even prevent them getting a test, because a test then implies isolation. And so I think that could be one thing that we actually get to grips with in the very near future. How are we going to increase the financial compensation for people so that they can actually isolate appropriately? Because that's absolutely at the core of virus control. It's no point testing if you don't then isolate after that. So that's sort of one practical thing that we need to get to grips with. A different thing is isolation and quarantine on the borders. And as Anthony said, you know, there's the border north-south, and we're always in a slightly difficult position in Northern Ireland. We have our north-south border and we have our east-west border with different implications for each. Obviously, as the north-south border is a land border and there's a lot of cross-border activity, it would be good to coordinate more with the south and to solve problems like, you know, restrictions being imposed at different times so people can shop whichever side of the border is open, and corridors of if they impose different types of quarantine for international travelers in the south and the north, you know, there's travel from the north to the south or the south to the north, depending on what's happening, evading that quarantine. Those sorts of things can be fixed. But there's also another border, in a sense, an internal border, east-west, between Northern Ireland and the other countries of the UK. Of course, and we must see this not as a sort of an, oh no, Brexit border, but as a this is just in terms of pandemic control type border. I think it's necessary to start thinking more about when we need to have restrictions across that border in order to allow Northern Ireland to get its levels of virus down. So that could be either by quarantine of people coming from other countries of the UK, and or requirements for negative testing, which is being discussed now, of course, at a UK level in response to the new variants, but hasn't been very much thought about before. But I think we need to think creatively around both the borders of Northern Ireland. Some of it is just temporary while you're getting levels down. Some of it is, you know, until vaccination has done its work, but to be really open to using the borders as a help in pandemic control. And then another sort of practical aspect is to look at the advancing science on how the virus transmits. And there's more and more emphasis on aerosol transmission, which as opposed to surfaces and droplet transmission, means that the virus is transmitting over longer distances in terms of physical distancing. And if we need better ventilation to make shops, businesses, workplaces, restaurants, etc., safe for people, then we should be preparing that, particularly now while there's a lockdown, looking at the ventilation standards and looking at how they're inspected, and in general having inspection systems that mean that businesses aren't penalized as a sector for, you know, some of the sector not being up to standard in terms of their of the safety of their venues. So I think we can do more around ventilation and people's understanding of ventilation and standards of ventilation, inspection of ventilation, etc. Isolation support, ventilation inspection regimes, acting early, thinking about the border, those are all things I think we can do in Northern Ireland. But it's important to have a goal. And as Anthony says, we believe that the goal needs to be keeping the virus down very low, near zero, meaning community transmission is almost eliminated, being really aggressive about keeping it down, getting it down there and keeping it down at low levels. And that's better for the economy, and not entering into this sort of, oh, we must let business open up as soon as possible, because it's not viable. It just means there'll be another lockdown. So it's not good for business to open up as soon as possible. It's better to get this problem dealt with. And vaccine, of course, will help deal with the problem as we get towards the end of summer, when it's projected that in Northern Ireland the mass vaccination will be done in the summer. At that point, if all goes well, we can hope that we're approaching herd immunity, and things can open up very much more then. But we shouldn't be opening up earlier than that, and we shouldn't be giving in to calls that as soon as the most vulnerable are vaccinated, we should open up, because that's just going to mean, as Anthony was saying, very high virus levels if you let it rip, and huge implications from allowing that to happen for both health and the economy. But I think it's perhaps most useful to have a discussion with you rather than me going on. But those are a few specific points that I wanted to add to what Anthony had to say.
Thank you very much, Alan, and thank you, Anthony. I'm going to open up the floor now. We'll take a few questions, and then maybe three or four questions, and then we'll come back to you and you can answer, and so on. We'll continue like that. So first on the list is Councillor Barr. Raymond.
Thank you, Chair, for that. Thank you, Helen and Anthony, for that presentation. I'd just like to ask your views on two things. What's your view on an all-Ireland strategy in terms of implementation of guidelines, combining of resources to tackle COVID? And the other thing was, what's your views on airports remaining open for domestic flights on the island?
Well, I think it's the more we can coordinate on the island of Ireland, the better. And I talked about two particular areas in terms of coordinating the restrictions and coordinating quarantine. But of course, the reality is Northern Ireland is part of the UK and depends a lot on the UK for financial packages for business, which is determined from London, and for the testing services and all sorts of things. So, one has to have a coordinated strategy on the island of Ireland, but also across the UK. And that's it. It's a complicated situation, but I certainly think that the North and the South could do more to coordinate than happened over the last year. And the more that they can do that, the better. In terms of whether the airports should be shutting to domestic flights, I think we need to be more responsive when we find out that there are, for example, that there are new variants, as to the possibility that we should restrict travel within the UK. I don't think we should at this point, because in fact we have, if you're talking about the new variant, we have already quite a large proportion of the new variant. At this point, it's rather too late to do that. But I think as time goes on, we have to be more open to restrictions to travel from other countries of the UK, which means imposing quarantine or hotel quarantine in order to be able to manage the situation and in order to be able to coordinate with what's happening down south. But that it's a bit chicken and egg, because we're told that in the south, they're not going for a COVID elimination policy because the North is not going to agree, and the North is not going to do it because of something else. However, I think that being so reluctant to control travel within the UK is not useful. And in fact, if you look at Australia, for example, in order to achieve COVID elimination in Australia, they closed the borders between all the states. And that was a necessary measure to get things in control in each state. and when they had done it within each state of Australia. And of course, these things are not easy, and it causes a lot of distress to people who need to cross the border. But it's a community decision as to what is worth doing for the end prize. But once they had achieved elimination in all the states, then they opened the borders. So I think we do have to be open to closing internal borders within the UK between countries.
Thank you, Helen, for that.
Temporarily, I'm talking about. Anthony, I don't know whether you want to add to that.
Very briefly, yeah, you're absolutely right. They had the Australian state borders have been open for over 100 years, and this is the first time they've been closed in living memory. But they did close them, and they did bring in special arrangements for the people who lived close to the border or the people who worked across the border, and they were very much predicated on exactly what was going on in the particular local area. And that seemed to work. It worked to minimize the hardship and minimize the disruption. But as a temporary measure, I would think it was probably worth considering.
Thank you, Anthony. So I'm going to take a few questions in a row, and then you can answer them. So on the list next, Councillor McHugh.
Thank you, Chair, and thanks as well to Helen and Anthony for the presentation. Helen has essentially covered the point I was going to make. Wasn't really a question, but it was the thing that jumps out at me listening to both Helen and Anthony there is that on a one island, small country with two jurisdictions within it, that it makes absolute sense that we should be tackling this problem with an all-island coherent strategy. Something that my own party has been calling for from the outset of this virus. And it's not coming from any party political ideology, but if we're concentrating our resources on a small island and having our strategy totally in harmony with each other within the two jurisdictions, then obviously we're promoting the preservation of life, and I think that's something that we should be focusing on. But as I say, I would like to thank Anthony and Helen for the presentation. Chair.
Thank you, Councillor McHugh. Alderman Devaney.
Thank you, Chair, for allowing me in, and can I say welcome to Anthony and Helen here for their presentation. I want to go through Anthony's first. Very, very true. I think the impact of the virus has been a difficult time for everyone with severe restrictions, and these restrictions are mainly put in place to keep the infection rate down and to protect our health service. And he spoke briefly about the economy reopening again, and the rates started to rise again. So, and he used, I think, a very good terminology that the health service were creaking at the seams. And he did talk then really about trying to get back to normal. And I do agree, it's going to be an open and close situation until we get back to some normality. And I think that can only be achieved with mass rollout on the vaccine. I've just heard some of the timelines for rollout of the vaccine. He mentioned the UK in October. I have a son of mine who lives just outside London, and he was telling me, I was on the phone to him at the weekend, that he's a head teacher of a school, well over 1,000, maybe 1,500 students, and his vaccination will not take place until the middle time, May time of April 22. So that worries me a bit, and I think that needs to be short-circuited here in Northern Ireland as well as the UK. And once again, it's to protect our health workers and frontline staff. I do take on board Anthony's issue with contact tracing. He has mentioned here that there's one issue that in the Republic would be behind what we are probably here in Northern Ireland. I want to just go on to Helen. Helen, thank you for your input and discussions on around other areas and how well they have done. You talk, Helen, about the issues in Northern Ireland, and you mentioned the UK being late. When 3 days ago, when I looked at the situation in the Republic, I mean, with all the measures that you say they have down there, despite you saying that we were late, the Republic of Ireland had the highest rate of infection in the world per head of population. And I just want to go on, and I do believe the issue of flights have been clearly mentioned here. And I do understand that flights is a very, very complicated issue. But I do believe that there's one issue to sort out flights to Northern Ireland is anybody entering Northern Ireland that should receive a COVID test before they come here. And I'm just wondering, would Helen agree? Am I right in thinking if someone gets a COVID test and it is negative when they travel into another country, that they don't have to isolate? I think I'm right in thinking that. And there was talk there about the and around the airports. But I just want to ask Helen the question on around, and it's no political issue either, as someone else has said, closing the border between the Republic and Northern Ireland, because Helen, you quite rightly did mention that there is an issue when shops are open in Northern Ireland. Shoppers down south or whoever that might be will come to Northern Ireland, and it will be vice versa when the role is reversed the other way. But once again, thanks for the
you, Alderman Devaney. Councillor Harkin.
Thank you, Chair, for letting me in, and thank you as well to Anthony and Helen for excellent presentations. And it was People Before Profit that proposed that you get the opportunity to come here to make the presentation today. And I apologise that we didn't make the proposal earlier. We made it in October, and we should have made it back in March, because you've been making this proposal, this strategy proposal since then. And hopefully some good will come out of this presentation, because there's representatives here of all the major parties up in Stormont. And I would say that we're in a situation now where it is terrible across the island. And the reality is we have not protected the economy. The coalition government has failed to protect the economy. The Stormont executive has failed to protect the economy. They failed to protect people's lives. They failed to protect the health services. And that's why the health services are creaking, because of the policies emanating from the two governments on this island, who were incapable of actually developing an all-island strategy to deal with a pandemic on an island. And I think Helen put it perfectly. This isn't about borders. This is about having a rational policy to actually deal with a health crisis. So there's a way that people talk about this virus as if it's inevitable that here we are again, and the infection rates are out of control in the north and in the south, and that's just the way it is, and it's inevitable that the health service is under the pressure that it's under, and that people have died. None of this needed to happen. There were actually other strategies that could have been implemented, and as Anthony said, the coalition government in the south wouldn't even look at the zero COVID strategy in favour of living with COVID. And in the north, we know that the Stormont executive started out backing the Tories, and then we had a campaign to get them to shift, and it's been U-turn after U-turn since then. So it's not just about an all-Ireland strategy. That's not enough. It's about having a zero COVID strategy, which requires the kind of steps that Anthony and Helen have talked about in terms of being able to be not pandering and keeping open businesses because they're lobbying, and then ending up with half measures, that means that there's a lot of community transmission. We should have been able to take decisive steps at the start, right across this island, and I think we'd have been in a very different situation right now. We could have been where New Zealand is, and we've been living now with this for almost a year. And there is hope at the end of the tunnel because we do have a vaccine now, but the vaccine is not going. We're not going to get mass vaccinations for months, and so I think we can't just have a let's hope for the best attitude right now. The Stormont executive and the Dáil were both told that the infection rates were likely to be out of control and at their worst at this time of year because of winter transmission of flus and everything else. And what did they do? They both opened up the economy before Christmas, and everybody knew that this would be the outcome of it. So it's not that this just happens. People are culpable in putting the health service under pressure. People are culpable for these rising infection rates, and then they went around and tried to blame the public for their policies. So I would urge the parties here to take seriously these proposals for a zero COVID all-in strategy, and I think as a committee we should call for the Dáil and Stormont to implement this strategy. Thank you, Chair.
Thank you, Councillor Horgan. Thank you. Near Helen there, want to come on any of those members' questions?
Well,
I don't think there was too much in them there now. If you want to go on, I've more members looking to ask here. So,
just to comment on the last questions and comments, I think it would be worth asking for a formal evaluation of the zero COVID option or COVID elimination option, because at least in the South, it has been mentioned by the government as something that they weren't going to do, but at least they mention that it's an option. And I think in the North, it's been roundly ignored by the executive. And although it's not for us to say what the strategy necessarily should be, it should be considered at the very least. And we must have a properly argued reasoning why it's not being followed. So I think at the very least, we're owed an explanation of why the zero COVID option is not being considered in the North by the executive and by the Minister of Health, in fact. So that's one thing in terms of zero COVID. Another is in terms of blame and compliance and all that sort of thing. I think we have very little local data to substantiate what's actually going wrong in transmission, and we need to look for much more transparency in the evidence that's being used to shape policy as to who should be observing restrictions more. Where is the transmission occurring? In what settings is it occurring? Are we collecting data about that? If so, are they being published? We need a more evidence-based and transparent approach to identifying where the problems are occurring, rather than saying it's due to lack of compliance by sections of the population in a very general way. Thank you.
Alderman Hussey.
Thank you, Chair, for allowing me in. I'm not a member of the committee. And thank you to Anthony for your presentation. I suppose to put it in context, we're looking at a situation currently, as already been referred to, where the Republic of Ireland has now got the worst infection rate in the world. And the last time I was looking, Northern Ireland had, I think, the best situation within the British Isles, with one case in every 200, as opposed to much higher rates within other parts of the British Isles. So within that context, I'm mindful of those who would call for an all-Ireland policy, but I'm mindful that, for example, New Zealand is not one island. And I mean, why would you not call for a British Isles policy or way forward on this. It would seem more logical to me, given the interdependency between all parts of the British Isles. As a business person, I'm a publican. I totally agree with you that the stop-start regime has been extremely detrimental to business. And from a business perspective, I'm sure there are a lot of business people in my shoes would simply say, you know, there shouldn't have been this stop-start. If we're going to stop, we're going to stop. Let us start when it is proper and safe to start. With regard to national health being overwhelmed or under stress, we all realize the situation that's happening there. You said yourself there that it perhaps wasn't down to the people, it was down to policies. But there's also an issue there. The policies are there, and I wonder if there was a much more stringent enforcement and people were sticking to the regulations, how much impact that would have had on the spread as we move forward. And I suppose finally, with regard to your presentation, and you're being critical of administration north and south, have you asked to make your presentation to the Dáil, to the Health Minister in the Republic of Ireland, to the Health Committee at Stormont, to the Health Minister? Now, you said the issue of zero COVID was not considered by the Health Minister. I think Robin Swan, and I would do as an Ulster Unionist, Robin Swan is doing a tremendous job. You know, and I think the Robin that I know is a person who would take all avenues, all solutions into consideration, and of course is well advised by the Chief Medical Officer and the Chief Scientific Officer. So, I mean, has there been any attempt to bring your academic paper to the attention of the people who actually make decisions, rather than coming to a council who you know, we don't have as to the restrictions that will be imposed upon us from the various administrations, but have you gone direct to the relevant administrations and to their advisors with your papers? And what, if you have, well done, but what has been the response? Thank you, Chair.
Thank you, Alderman Hussey. Councillor Edwards.
Chair, thanks for letting me in, and I also want to thank Helen and Anthony for their presentation. And I did second Councillor Harkin's motion to invite them here today, so I'm glad they're both here to give their presentation. And I do fully agree, as other speakers have said, about the Ireland approach, and I suppose it could have been a lot better. And when you look at our own council area, Chair, in last year in spring, we had, I think, the second lowest rate of COVID infection in the whole of Northern Ireland. And as we went into the end of summer or into the end of autumn, we had the highest in the UK, where it went out of control. And as other speakers have mentioned, we have had lockdowns in place and them lifted. I think people refer to lockdown 3.0 at the moment. But what I want to ask about is in terms, especially in terms of community transmission, is that I do see it. Thankfully, it's not the majority of people, but there is a minority of people out there. There's apathy towards COVID, towards the restrictions, and there is complacency sort of setting in, not amongst everyone, but amongst a few. And we still see community transmission rising. I'm wondering what Helen and Anthony's view are on how to tackle that sort of complacency and apathy in society at the moment. Thank you, Chair.
Thank you, Councillor Edwards. I will, Councillor Ferguson, I'll let you in there as well.
Thank you, Chair. Thank you, Helen and Anthony, for your very informative presentation today. I must say it's good to see the different strategies put forward, and I must say you've been very sensitive around a lot of the issues, obviously, that have been raised by previous councillors when it comes to the politics behind it all. Sticking with the information and trying to get that information out to our electorate, I just wanted to ask your views on, you had said that there was a study saying that 60% of the infection rate wouldn't necessarily be enough for herd immunity, even though I hate using that term, it's been used so much recently. But when that comes to the aspect of vaccination, obviously we've seen a big push from anti-vaxxers, myths and disinformation. What do you see would be the biggest kind of obstacle if we don't have 80% of people vaccinated? And what would you see the strategy going forward from there? But no, thank you very much. Cheers.
Councillor Ferguson. There's only one more indicated speaker, so I'll Alderman Wark, if you want to come in there now.
Thank you, Chair, and thank you also for the presentation. And I'm sort of thinking here, I'm really glad we didn't take the All-Ireland approach, and it's not a political point scoring, but obviously with the start of Christmas, and I think Ireland, the Republic of Ireland, was obviously one of the lowest in Europe, and then more or less they come out now with the highest in the world. Obviously they were completely different with the stuff, the closure. They had the restaurants open, they had the Boxing Day, they had the shops, they wanted Christmas normal. For us in Northern Ireland, obviously it was completely different. We had more or less when they lockdown, and I do feel now that the decisions were correct up here. Unfortunately, the numbers are high. I'm glad to see the figures starting to come down, and obviously with the Republic of Ireland, I pray and hope they will come down a lot more quicker than they are. But I do agree with Derry Hussey would be more or less the British eyes looking at a response instead of the Ireland, everybody and it together. But I do thank you for the presentation today. And at the minute, I'd be really looking at these borders closing, full stop, more or less to contain it, and the Republic with the fiction down there. But thank you, Chair.
Mark, Helen, if you would like to come in there, or Anthony again now.
Maybe if I start with that, Helen, if I can.
Okay.
With regard to British Isles, that's a really good question. The short answer is there are two groups. There's ourselves and the Independent Sage group, who are UK based. So we work together, we share members, we share information. There is not the thickness of playing card between what we would like to do and what they would like to do. So from our point of view, it makes more sense for a UK-based organisation to deal with the UK government, and for an organisation based on the island of Ireland to deal with the jurisdictions in the island of Ireland. But there is an enormous amount of sharing of information. And as I said, we have quite a number of common members. So you're absolutely right. I think two councillors asked that question about a British Isles response. You're absolutely right. It would make a great deal of sense. And we have placed these matters before the various governments involved. And I might turn on to the point about vaccination, and then I will ask perhaps Helen to address the point about our dealings with the Northern Ireland Executive, because she's been involved with those and I have not. In terms of vaccination, the evidence we have says that at 60% infection rate, you can still get further major outbreaks of COVID-19, which is not what anyone wanted to hear, but it seems to be true. So the suggestion from the virologists, and I think they have reason on their side, is that we will need 80% coverage to stop the virus circulating. And we hope that's true both for the existing strain and for the new UK strain and the new South African strain, but we don't know about those two strains. Our experience is that there are a small number of people who are anti-vaccine, and there is no way to give them a vaccine except to physically sit on them and force them to take it. And that's not an approach we want to follow at all. But there are many people who are vaccine hesitant. So I met a friend of mine in the street this morning who is a North County Dublin cauliflower farmer, a man with his feet very much on the ground. And we were chatting, you know, how's the family, how was Christmas? And he asked me about the vaccines. And what he wanted to know was could he be reassured that the vaccine was a reasonably safe option? So we talked about it, and I said, well, I'm getting it, and I think it is safe. And I've looked at the information on it. And it's those and he's going off to get it when it becomes available. And it's those conversations with people, not necessarily grandstand engagement with anti-vaxxers, which just sort of annoy everybody, but it's those one-to-one conversations with people that help to change people's thinking about vaccines. And most people you will meet are vaccine hesitant rather than, you know, completely anti-vaccine as such. And that's how I think it needs to be dealt with. Perhaps if I pass over to Helen at this point.
Yes, thanks, Anthony. Going back to the point, why not a British Isles solution? You know, obviously, and as Anthony said, the preferred position is that all of the UK and all of Ireland adopt a zero COVID type COVID elimination strategy, and Independent Sage has been arguing for that, as Anthony said, and there are many voices in England arguing for that, in Scotland, I think in Wales as well as Northern Ireland and Ireland. So this is not saying that it should be an island of Ireland strategy, is not at all exclusive of saying that it should be across the UK and Ireland. So far, I don't think one could say that there's been much success in terms of the England looking like they're going to explicitly adopt a zero COVID strategy. But with the new variant, things are changing in the way people are looking at it, and the new variant is a problem that has come about because we allowed virus levels to remain so high that it was possible for these problems to arise. And I think even the discussions now of the UK government in terms of testing all new arrivals and requiring negative tests, that's in response to the new variant, but it is in line with a more COVID elimination policy. In terms of whether we took this to the executive, yes, I mean, the paper that Anthony shows, a slightly sort of Northern Irishified version of it, was sent to every MLA, and we've also tried to contact the Minister for Health. The Health Committee of the Assembly has been interested, and in fact they were contacted first by Independent Sage, because of course in Northern Ireland, where, you know, at the intersection of, if you like, the two groups, Independent Sage and ISAG, and we work together. So the Health Committee did endorse a zero COVID policy, and as I understand it, they wrote to the minister, and as I understand it, they didn't receive a response about that specifically, but you'd have to ask them for details. But so I don't think now, you know, and I think it's very important to say as well, in this pandemic situation, one can have one's arguments, differences of opinion, of strategy, etc. But I am not doubting for a minute the hard work and good faith that has gone into managing this pandemic from the basis of the Minister for Health and the Health Service and many others involved. So really, first of all, we should thank them for all their hard work, but we do differ on the overall strategy and goal, and it's important to talk about that without taking away from the successes. And the vaccine, the start of the vaccine campaign is one of the successes recently in terms of pandemic management. So the short answer is yes, we have gone to the executive. In terms of how to deal with apathy and complacency. That's difficult. It's a difficult area because it's gone on so long, and if people don't see an end to it, I think it can be very difficult to turn around. So, I think having a very clear goal of where we're trying to get to and the possibility of getting there is important. And we haven't had that goal. We haven't had a clear strategy. We haven't known where we're going other than trying not to overstep the capacity of the hospitals. So moving to zero COVID is a clear goal that people could sign up to, and they would know when they've got there, and the economy would reopen, etc. But it's not a simple problem, so I'm not at all saying that it could be simply solved. I think Anthony has talked about the herd immunity question. Would we have too much vaccine hesitancy? It appears, I think, that if you look at the take-up of the flu vaccine, that was very good. That's a sort of a baseline expectation of what the take-up of the COVID vaccine would be, and there's probably a higher motivation to take up the COVID vaccine. So with good wind, we should be able to get high vaccine take-up rates, but I think we'll have to see as it unfolds. And as Anthony says, we all have a responsibility to engage in the conversations and meet the conspiracy theories, etc. But there is probably a hard core of anti-vax that we're never going to convince them. But it is the larger group of hesitant people that we need to talk about, who are open to hearing what the facts really are. I think I've covered.
Thank you, Helen. Listen, I'm going to let Councillor Harkin in very quickly again. So keep it short, Sean, if you don't mind.
Thank you, Chair. Yeah, and thanks again to Helen and Anthony, because that was very, very clarifying, especially on the question of the Britain and a COVID strategy there, because there's people campaigning for that very objective. And of course, we would be all in favour of that. I'm going to put a proposal for the committee in there to discuss, because I think we should send a clear message from the council. If people can give that a quick look based on these presentations. I was dismayed there by the contribution from the DUP, which I believe called for the border between North and South to be put up, if I'm not wrong, to stop the infection rate from the South coming up to the North. And we live in a border county here, and just think about how disruptive that would be for people's lives. We have health workers who work in Altnagelvin who live in Donegal who would be stopped from coming to work. I mean, this is just ignorant and unbelievable. And it partly explains why we're in the situation that we're in, because it's very clear from the presentations that the Zero COVID work group has done its work in proposing to both the coalition government and to the Stormont executive to look at this proposal seriously, and they haven't. And that's why, look, law and order is not going to solve this. Part of the problem is the people who are calling for law and order. It's the executive says one law for us, another law for everybody else. So of course, people are exhausted and are fed up being told by parties that they don't see following through on what they're asking others to do. So I think from the Derry and Strabane Council, we have to send a clear message that there's an urgency right now to developing and having an all-Ireland response. We've already got a memorandum of understanding that calls for an integrated approach from the health services and government on both sides, north and south. So this is really developing and building on that, given the situation that we're in right now. So I hope that this is something that the committee will agree to recommend that we do. Thanks.
Okay, thank you, Councillor Harkin. I'll just finish off by saying thanking Helen and Anthony for their presentation. I think Anthony has gone on now. He had a family problem to deal with there. Thank you very much for that. That was very much appreciated, very informative. And I'm sure the members were appreciative of it as well. Thank you, Helen.
Thank you very much. Shall I leave the meeting now then?
If you would like to,
Yeah,
if you want
that's
to stay
great.
on,
Thank you.
I don't think you want to be bored with the rest
No.
of it.
Thank you very much indeed for listening to us, everybody, and I wish you all the best with managing the situation in Derry and Strabane.
Okay. Thank you, Helen. Thank you. And okay, we have a proposal on the floor there from Councillor Harkin that has been seconded by Councillor Barr. So anybody want to come in there now? We have Morris, or Alderman Devaney.
Thank you, Chair. Just for a point of clarity, have we not been through this previously before, this issue about an all-Ireland issue to deal with COVID? And just for Councillor Harkin, I just want to let him know that we will not be taking any lectures from Councillor Harkin. We have difficult issues to decide here, and when you look at the zero rates, between Northern Ireland, he says they have failed. It's interesting at the moment we are one of the lowest. We're one of the lowest rates, and even take with the rate between Northern Ireland and the Republic. As I said earlier on, the Republic are in the last number of days have been the highest in the world. And how does Councillor Harkin explain that? Thank you, Chair. And Chair, our party will be abstaining on this proposal.
Okay. Okay, thank you, Alderman Devaney. Is there anyone else wishing to speak on Councillor Duffy? Go ahead there.
Thank you, Chair, for allowing me in, and I would just caution Morris to be maybe a wee bit more measured in his language and what he's saying in terms of the rates, because we have been here before where rates have fluctuated between the north and the south and all over the place. So, you know, what's high one day might be low the next. So I would just caution him on that. In terms of the proposal in front of us now, we obviously we have always been calling for an all-island approach. And an all-Ireland approach, we're a small island. We have looked at New Zealand. We have looked at them with envy in recent times in terms of how they've managed COVID. Unfortunately, here we are in a five-party coalition, which sometimes it's not easy when other parties use cross-community vetoes to prevent health papers going before them. So unfortunately, that's the situation we're in. But in terms of the proposal in front of us, I would propose a small amendment from urgently implement. I would change that to urgently consider. We don't here set health policy. We don't here have the scientific data that the health minister does have. So I would just caution in terms of that. So that would be the small amendment that I would propose at this time.
Okay, thank you, Councillor Duffy. Councillor Harkin, I'm not going to bring you in yet because I'm going to ask other people if they want to come in, but are you happy enough with that proposal for the amendment? You can come in there and answer me if you want. Councillor Harkin?
Hi, Chair. Thanks. Yeah, I'm fine with that amendment. And
okay.
And I'm happy to wait to respond to Alderman.
Just if there's anybody else wants to speak, and then you can sum up then. Sure.
Chair, Alderman Work here. Could I put an amendment on that, please?
Just hold on a minute there, Alderman Work. Did you want to speak, Councillor Gallagher, or are you okay there with that?
I'm fine on the chat box, Chair.
Okay, no bother, Councillor. Councillor Work, or sorry, Alderman Work there.
Chair, I'm just going to put it on the chat box here. So it's more or less Council calls on Stormont second of the Dáil the West Scottish English coalition governments to urgently implicate on all islands. So there's an S at that instead of all islands, zero COVID strategy to eliminate the community transmission and the virus in order to protect lives, health service, and they bring return to normality. That's it, Chair.
Okay, thank you, Alderman Wark. Do you have a seconder for your proposal?
That, Chair.
Okay. Alderman Devaney. Folks, that is another proposal on the floor there now. Does anyone like to speak in that?
Sorry, on which, Darren, on what specifically?
Oh, sorry, on the second one. On the second.
The wrong time or the wrong.
Sorry, Chair. The amendment that I proposed, has that been accepted?
Yes, yes, it has. Councillor Harkin was happy to put that in there.
Right. So is Alderman Wark, is he then changing my urgently consider to back to urgently implement? Because I don't believe that under standing orders that you can do that.
Councillor Duffy, I have no issue, but I'm not that quick a typer there. It's obviously a difficult situation in terms we're under here, but I have no issue putting that on that.
Yeah, I'm just seeing that now, Councillor Duffy. Sorry about that. I don't understand there. If he changes that there, they urgently consider. Okay, so are we happy enough to take a vote on Councillor Wark's amendment to the proposal? Is that okay with everyone?
Can I come in, Chair? I just want to make a point.
Yeah, go ahead.
Look, I mean, is this serious from Alderman Wark? Because he, in the last, when the two representatives were here, he called for the border. He called for a border to go up between north and south. Now he's calling for an all-island COVID elimination strategy. Does the DUP actually support a zero COVID strategy for the island of Ireland and for Britain? Is that what they're calling on the Tories to do? Because this is not being serious. Otherwise, this is about them and us stuff. Because people are in hospital, as he knows. The health service is overwhelmed, and this is messing about. So I would just ask them to reflect on that. Do they actually support a zero COVID strategy? Is he going to go and argue with Arlene Foster that now that the Derry Strabane Council's backing this, that we should implement this and argue with the Tories to do it? Is that what's happening here?
Here, can I come on there?
Yes, Councillor.
Obviously, what I said, I agreed with Alderman Hussey with the old British Ice, but I do agree with the border closing at the minute, especially with the infection rate down in the Republic of Ireland. Republic of Ireland at the minute is the highest in the world, and obviously our people are coming down. At the present minute, I would call for yes, borders to close. Obviously, with this year, I do want to see a light. I want to see a road towards zero COVID, and I would totally agree with more or less what I see is England, Scotland, Wales, the Republic of Ireland, Northern Ireland, all working together and more or less getting out of this mess. It's simple, so it is. Councillor Hart.
Okay, thank you, Alderman Wark. Folks, members, we'll take a vote on Alderman Wark's proposal. Obviously, urgently consider. That's what it should be. So if we put that to a vote, members. Karen there.
Yes, Chairman. Can you hear me? Yes.
Yeah.
Okay, so then I'll start. So Alderman Devaney.
For.
Alderman Guy.
For.
Alderman Wark. Alderman Ward.
For Karen.
Okay. Councillor Barr.
Against Karen.
Councillor Burke. Councillor Burke. Councillor Duffy.
For.
Councillor Edwards. Councillor Farrell. I'm sorry, Councillor Farrell.
For.
Councillor Ferguson.
For.
Councillor Harkin.
For.
Councillor Logue.
For.
Councillor McHugh.
For.
Councillor Mooney. Councillor Mooney.
For Karen.
And Councillor Riley.
For.
Thank you.
I think Councillor Burke there, did you get Karen?
No, I didn't get Councillor Burke. No. Councillor Burke is voting.
Sorry, Karen. Councillor Burke is having real difficulties with her mic at the minute. So I don't know if I think she's even having problems with the chat box. But she has 4.
Okay, thank you.
Chair.
Yes, Alderman.
It's see on that too. It was all islands, which you pointed out. If you look on the group chat, all islands and a more or less. I'm looking at.
Yeah, it is all islands. Yeah, it was just that they're urgently considered on all islands. Yeah,
and that's all Ireland there. Thank you, Chair.
Yeah.
Mr. Chair, just in terms of that 13 for, 1 against.
Thank you, Karen. So folks, the substantive motion passes. So that proposal of Alderman Mark has passed. Thank you, members. We'll move on now to, well, Alderman Mark, would you like to sum up on any of that, or are you happy to move on?
No, Chair, I'm happy to move on that. Thank you.
Okay, thank you.
Sorry, Chair. I don't think it's not Alderman Wark's motion simply because he added an amendment.
Well, if you would like to sum up, then go ahead.
Well, look, I think that this was a very serious presentation today, and I think as many other councillors don't appreciate what Councillor Wark has done here. On the one hand, he's arguing for borders to go up, and then arguing for a zero COVID strategy for these islands. And so I expect him now to take this seriously and to actually put this forward to his party, rather than just messing about with people's lives here in the Derry and Strabane Council, because that's what this amounts to. As the speaker said, they work with people across the water. There is a campaign across the water for a zero COVID approach, and that people have to remember that what happens in here is noticed, and that people from all communities are struggling right now in their houses, struggling going to work, and struggling with being out of work and all unable to pay bills. So I hope for the zero COVID group that this gives them some confidence that they'll be able to get a hearing now in Stormont, in the Dáil, and in Westminster, if that's possible. Thank you, Chair.
Thank you, Councillor Harkin. Right, members, we'll move on now to item 6, Chairperson's business. I have a few things here just that I want to bring up. First of all, the 2 recent barbaric punishment attacks in the city are disgusting. They achieve nothing. They do nothing but spread fear in the communities. And at a time when Altney Galvin hospital staff are severely under pressure due to COVID, this does nothing to alleviate the problems they face. And at that, I would like to pass on thanks and appreciation to the Western Trust staff who answered the call, an emergency call at the weekend by the SWA, also Craigavon area hospital as well. They were under severe pressure, and all staff that were off made it in, and they were able to assist in bringing that their emergency under control. So I'd like to commend them all on that there. And I'd like to welcome the announcement by the Health Minister for funding for the new specialist perinatal mental health service. They reckon it's going to at about 4.7 million per year, and it's been very welcomed by campaigners who've been campaigning for years now in that there. I'd also like to, I think that's everything there for now. I would like to congratulate recent recipients of Queen's New Year's Honour List. William McElhinney, who is an old primary 7 teacher of mine, Greta Campbell, who a costume maker and fundraiser with the Solace Centre, and Alan Moore, who is in charge of mass incident emergency planning in the Western Trust. And that is everything I have. There is also, and I've been contacted by Councillor Duffy about this as well, and it's to do with the Community Support Service and the third tranche of DFC money. Now, I know Councillor Duffy wants to talk on this, and we would maybe better to leave it to confidential business if everybody's happy at that later on, and you can talk on that then. Councillor Duffy, are you okay with that, or?
Okay, can I get the rationale? Why confidential?
Well, no, I was just thinking that obviously involved sums of money, and we haven't had a paper on it yet, and it hasn't obviously hasn't been signed off by full council yet. Now, if you are happy to discuss it now, that's no problem. But I just felt that seeing that sums of money were being discussed, that it might be better under confidential.
Yeah, I would prefer to it in open business, to be honest, Chair, unless there's a reason for it not to be.
There's no reason. I'm just thinking that obviously there'll be other. I know there's going to be maybe other things mentioned that are forms of help for people.
Yeah.
So on. So that was just me thinking on why it might be better and confidential. But if you are all happy enough to discuss it now, then I have no problem with that.
I would propose it stays in open business. It's chairperson's business, just.
Well, that's okay. No, that's okay. As I say, we know that I've been contacted by obviously members of the Waterside Neighbourhood Partnership say that they have been. They're obviously the money is running low, and basically the uptake of the scheme has been really, they've been overwhelmed by the amount of numbers this time round, and they're actually finding it hard to cope on the phones and stuff at the minute. But we obviously know that there's more money there now, which obviously has to be signed off. It has to go to council. So that's what I'm going to say in it now, and I'll pass it over. Councillor Duffy, if you want to talk there on it now, because you did contact me in that, so go ahead there if you want to talk now.
Yeah, thank you, Chair, and I do appreciate that. And I know that we're talking about sums of money and we don't have a paper here in front of us. But unfortunately, as you have outlined there in terms of yourself and being contacted by the Waterside Partnership, likewise, I have been contacted by Triax and the North Partnership here. And I know that other members of other parties have been contacted as well. And as you say, that it's that warm, well and connected programme that went out. The first tranche of it, or the second tranche of it, and it has been oversubscribed at this point. I know in terms of the outer north area, they have gone into um, their own money to try and sustain it, because it has been a perfect storm of January in terms of hardship. January is a difficult month anyway, but with COVID on top of it, staff furloughed, staff with job losses, children home from school, more pressure within households. So fuel in particular has been a huge issue over the last number of weeks. And I know that a number of the neighbourhood partnerships are now running at a loss to themselves in terms of getting money out to people for fuel and that. And I do know that there is a paper coming, but the urgency of this is that we can't wait until February until a paper comes. We can't wait until the end of February, which is March, to have it ratified by full council. We need money out on the ground now, to allow our community support hubs to continue the work that they're doing. They are hoping themselves to come February, the need for their service will be lessened, because January is just a particularly bad month anyway. So probably my first question is, in terms of the additionality of money, um, what additionality of money is there? Because I know that there has been a further announcement today from DFC around money for community support, and I know that there was money that was coming around connectivity coming into council, and I know then that there was additional money. So it's that additional money that I'm sort of looking to find out how much it is, and if it's there, I want to propose that it is directed to the community support hubs as a matter of urgency. And I know it can't be done without being ratified at full council, but I think it's really urgent and really important that we make this proposal here today, that money is redirected to our community support hubs, because we have elderly people, we have children at home who are sitting in freezing cold homes. It's going to cause illness, never mind anything else. Thank you, Chair.
Okay, there for that. Karen, would you like to come in on that?
Yes, Chair members, and just to confirm, our team have been given a verbal indication just prior to Christmas that we would receive further funding. We estimated, based on our previous allocations, which you will know when tranche 1 and tranche 2 were 280,000, that would be a similar amount. We have now been notified it is a more significant number, around 440,000. Our team had been working on a proposal for connectivity based on what our predictions were, and continue to do so. We have an internal meeting tomorrow involving our audit, procurement and legal teams, with a view that our paper will be coming to full council to propose the applications of that. So we are considering just sort of the detailed governance issues around that. So certainly it wouldn't be our view that we would be holding off on that paper until February. I haven't seen today's announcements, so I don't know what further funding is proposed, but certainly that is something that we will follow up with our teams. Just note in the commentary, Warm, Well and Connected programme was mentioned, and again our officers have a meeting with DFC tomorrow to discuss the implications of that programme. And as soon as we're updated on that, members will make you aware in advance of the paper what the relevant issues are and what the likelihood is of further allocations being available within that.
Okay, thank you, Karen. Of a number of indicated speakership. Councillor Raymond Barr, was it on this here you wanted to speak about the funding?
Yes, Chair.
Yeah, okay. Good, come you in there now, yeah.
I will support everything that Sandra has just said there. I would say in my own role as a councillor and as a volunteer with Strabane Community Project, I've seen myself a dramatic increase in the demand for services over the past few days. The need is rising in relation to fuel poverty, food poverty and electricity. I've worked with a community project since last March, and during that time I've not seen an escalation in demand such as I'm seeing now. As expected, mental health has also become a major issue with isolation, fear and health worries on top of the worry about fuel poverty and food poverty. That's exacerbating the problems that were being experienced even before lockdown. The community project in Strabane is instrumental in delivering Meals on Wheels, Good Morning Call and the social supermarket on top of being the main delivery partner for the Access to Food project, funded by DFC and administered by council. Another worry that I would see, or another concern I would see, and I feel council need to take note of it, is to me there's an imminent danger of staff in Strabane and in our districts suffering burnout, as the human resources needed to deal with an extra man just don't seem to be there. And I feel we in council need to be aware of the dangers present here in terms of staff welfare in these delivery groups. Thank you, Chair.
Okay. Councillor Barr for that there. Sandra, did you put a proposal there when you spoke at the end of yours?
I was just literally typing it. Hang on. That should be it there now. Very basic.
Okay, members, there is a proposal from Councillor Duffy there in the chat box. Seconded by Raymond Barr. Councillor Barr.
Teresa, fix my spelling mistake.
Councillor Harkin, do you want that on that one?
Thanks, Chair. Yeah, look, we are. It feels like we're back in March with the severity of this lockdown. A lot of people are in their homes, and I've been contacted as well, just like Councillor Duffy, by organisations who say that all people are having to shut their doors because they've ran out of vouchers for fuel, electricity, food, and that is very, very worrying. So I think we should do everything we can to make sure people are helped. I do want to say it happened while we were not in session, but the announcement that there was a 2 million underspend by the Department of Communities for the discretionary support fund was very, very, very alarming. And I don't understand how that could happen given the situation that we're in right now. And we asked as a council a number of times. We agreed we would write to the executive, asking the executive if it would fund the hardship that we set up before Christmas. I'm not sure if we got a response. I haven't seen a response, and that's why linking that to the 2 million underspend for the COVID-19 discretionary support scheme is very alarming. And now we're in a situation where, as we predicted, there would be far greater need. So I'm in favour of doing everything we can to make sure anybody in need from all communities has access to funding to make sure people have the basics in front of them. So I'm willing to support this proposal if that's where it goes.
Okay, thank you, Councillor Harkin. Alderman Devaney.
Thank you, Chair, for allowing me in. And I have to say, I do agree that we as council should be doing everything we can in this difficult situation. The only question I would have would be for Karen is, how does procurement work with this? Is everything okay with that there? And the other thing I just want to mention, Chair, is there was an underspend in the hardship fund. And I know the two charities were St. Vincent de Paul and, gibbers, I can't remember the other one.
Salvation Army.
Salvation Army. Sorry for that there. And there was quite an underspend there, and the two groups were unable to spend the amount of money. And I'm just wondering, because I have heard in the last number of days that yes, St. Vincent de Paul are able to help out during this issue, and always been very helpful with fuel issue as well. And it seems to be the main one that's coming forward is fuel. And I'm just wondering, what do we do with that money from the hardship fund? Do we come back to the two chair, especially St Vincent de Paul, with the money for fuel. Could I just have a wee update on that?
Okay, thank you. Alderman Defending. Karen, do you want to come in there on that?
Yeah, chair members, the resolution by council was that further report would come back to you in the new year outlining options and proposals in relation to the implementation of stage 2 of the hardship fund. And my understanding is that meeting was scheduled for the 2nd of February to accommodate the Roundtree Trust, but can be brought forward. And I think there are provisional dates and times being sought by the Director of Legacy to convene that meeting on either Monday or Tuesday of next week. I know we've had some conversations with our partner organisations, but I think we would need to formalise those before we would officially update, and perhaps we can do that at the working group next week.
Okay, Karen, thank you for that. Councillor Donnelly.
Thank you, Chair. I'm having some IT difficulties here, so I'm not sure if I'm going to be able to, do it without being interrupted. But no, regarding this, Chair, look, there's no doubt that there's a massive need and demand within our community, particularly those who are disadvantaged at this present minute in time. But I see there's huge issues with the procedures that are in place at the minute. I've spoke to a number of people who have been ringing numbers for days, and they haven't been able to get through. I've talked to 2 people today who eventually, when they did get through, were told that it would take another week. And I have spoke to 2 council officers earlier, and I'm hoping that they will address some of the issues that are being outlined. But there is a massive there's massive gaps in this, and I think that council officers need to be making a serious effort and a serious attempt at to plug them. Thank you.
Thank you, Councillor Donnelly. Councillor Ferguson.
Thank you, Chair, and I'm happy to support this. I was on a call yesterday with the rural areas, and they're experiencing exactly the same issues, and similar to what Councillor Donnelly I just said, that they have actually had to go out of their own pocket and purchase a second phone, and have 2 people been able to access the phone because the requests for fuel is just so much. There's stories of people have been offered food, and they're saying, look, I have well within my budget, my monthly spend for food, but I never anticipated having to heat the home for my 3 kids whilst homeschooling, and I just can't physically afford that fuel. So this is something that has been seen across in all areas, and not necessarily just deprived, but people who are working and can't afford that extra cost. So happy to support this in any way that we can bring it forward as quickly as possible. Thank you.
Thank you, Councillor Ferguson. Councillor Farrell.
Thanks, Chair. We're happy to support this. If there's money available, we should be getting it out to the people that need it. I have one question. In terms of the money, I understand that there's £300,000 for connectivity, and there's a further £140,000. Is it £140,000 that we're talking about to go directly to community support hubs for food and fuel? Also, I am aware that the Mayor, Brian Tierney, has been engaging with all the hubs, and there is a clearly identified need for this support to go out to the communities. I'm also aware of the COVID heating payment, which is a £200 payment to pensioners, people in receipt of pension credit, attendance allowance, DLA and PIP, at the higher rate or the enhanced rate, but that hasn't been issued to people yet. And there is a target date of the end of January for that support. So if those £200 payments were issued to people, it would reduce the sort of burden on the community support hub. So I would propose a slight amendment, just in addition, calling for the immediate release of the COVID heating payment. But I would appreciate some clarity on how much we're actually talking about. Is it the 140k or is it a different amount? Thank you.
Okay, thank you, Councillor Farrell. Karen, do you want to come in just to answer that question there?
Chair members, firstly, just in regard to the winter fuel payments, whilst this meeting has been going on, somebody has just advised me we have had an update from the department in relation to the schemes of support and timelines, and that has been updated on Northern Ireland Direct. So we'll send you that update, which you haven't been able, obviously, to read in detail, just for your information. It might answer some of the queries that have been raised around wider programmes and timelines. With regard to the discussions, I wasn't in attendance at the consultation meeting with the community sector yesterday, and won't receive a report on that from our officials until we meet tomorrow morning with our support teams in legal and procurement and audit. So that matter is to be determined. Obviously, there's been a level of consultation. I think the money exceeded what we anticipated we would get. So there's a level of discretion there in terms of how the remainder of that funding is spent. And we're happy to take members' views into consideration as part of that determination.
Okay, thank you, Karen. Councillor Gallagher.
Thank you, Chair, for letting us in, and again, like others, be supportive of this. I would just, and I'm not on this committee, but I would also maybe ask the committee to look about this proposal of adding something in around providing a resilience plan as part of this package. Chair, I would have concerns that that some of this stuff at some stage is going to come to an abrupt end, and it's going to leave communities in a bad place because it's not coming with resilience, and it needs to also come with some equity, that everyone is able to access this that finds himself in financial difficulties, just not people on benefits, but also the working poor that has been greatly impacted by this COVID, where we've seen working families, both someone maybe getting paid off within the family, people going on furlough and seeing a greatly reduced income into their household, but they get behind because they're not maybe on universal credit or another benefit. But we also need to support them to ensure that they keep their resilience. So if there was someone in the committee, I would really like to see get it included in the proposal. Thank you, Chair.
Okay, thank you, Councillor Gallagher. Councillor Duffy.
Yeah, Chair, thank you, and I do really appreciate what you're saying, Paul, around that resilience, and I would agree with you. But do you see in terms of that and tagging it onto this proposal, I don't think it does it justice. I think this proposal is really about trying to get this money out on the ground ASAP. The whole resilience stuff, I think that needs to be thought through wider, and I think that maybe that should be a proper motion that comes to council rather than a proposal here from the floor, because I do think that the whole resilience element of it is really important, whereas this proposal is about the here and now of getting stuff out on the ground as quickly as we can, but I think that it's a good motion for the future.
Thank you, Councillor Duffy, for that, and I would tend to agree there. It definitely is a great idea, and it probably would be better brought to full council. Councillor Burke.
Thanks, Chair, for letting me on. It's just obviously, in terms of just the comments around people not being dealt with and phone lines not being taken on, they no answered quick enough, and just they pass on to council officers when looking into it. I just like to mention, obviously, I'm involved in the Moor one, and the reason that there is a bit of a delay in people getting help and people getting called back is because within the last 10 days, we have probably had the same number of referrals as what we had since October. So it is inundated, and there is issues we want to be getting available. So it's just when council officers are looking at that issue, just take that into consideration and into account. Thanks.
Thank you, Councillor Burke, for that. I have no other indicated speakers on this, so take this to a vote. I think it's unanimous anyway, isn't it? Does no anybody speak otherwise there on it, or? Everyone happy with that, their proposal? Councillor Riley happy to second Rory's amendment? Everyone okay with that then? Passes unanimously? Okay. And everyone happy with that? No one else wants to speak in that there. So I will go back to just what I had started by saying. I just want to add to it because I forgot. I wasn't sure about someone there, whether they were a Milton Porter also received a BEM. Now, Councillor Donnelly wanted to come in on what I was speaking about there at the very beginning. So
yeah, Chair, thank you very much for letting me in. Chair, just that when you were talking about gun attacks and that there, and your condemnation, I noticed that you didn't take the opportunity to mention the attack on the water side where there was 9 shots fired at a house. The DUP. Now I am aware.
Can I just come in there?
I am aware, Chair. I am aware that you did on the media.
Yeah.
However, like the DUP, when it comes
to
sir,
I'll have to stop you there, Councillor Donnelly. I last month in my first meeting as Health and Communities, and you can go back and check this, I mentioned about those shots being fired because I actually know the occupant quite well, and I've been trying to help this man out for ages. So I think you need to go back.
Right, Chair. Yeah, no problem, Chair. Except that I was going to say that I know that you did say it in the media.
Yes.
But
yep.
Chair, there's when we're talking about gunmen here, there's something I would like to bring up, and it's a recent behaviour of the PSNI. There's been 2 incidents, Chair, and both of these happened to working class members of one in each community, Chair. One, I understand, was a member from the PEL community, which is very well documented, where he was pulled around a local supermarket like a rag doll. He was assaulted in front of his children. The children were very, very upset over this. The second one was when a man and woman were stopped going shopping to a supermarket, and they were told by the PSNI that they didn't think that it was essential. Their car was then searched. They were held in cold conditions for 20 minutes until another car landed with more PSNI officers wearing white boiler suits and breathing apparatus. Were then told that they need to go home and not come out of the house again. Now, Chair, this is not helpful, and I'm being diplomatic here. People are well aware of my position with the PSNI, but this is very clearly a case of working class people being abused by the extra powers that the political parties have bestowed on them, Chair. And I think, if you're going to be consistent with your condemnation and that, then I think people need to speak up about these incidents. As I say, one was from the PEL community and the other was a Republican. Thank you, Chair.
Thank you, Councillor Donnelly. The reason why I didn't speak in the matter at Tesco's was because that's still ongoing, as I am aware. That he hasn't been charged yet. So it was false reporting in the newspaper by that there. The other incident I know nothing about. So the Councillor Doyle wanted to come in on the same issue as Councillor Donnelly there.
Thank you, Chair. Appreciate you letting me in. I'm not a member of the committee. Like Gary, I was aware of the 2 issues, and particularly following the meetings that I had a good while ago with the neighbourhood inspector down in Strand Road. I was informed that if there were issues to be raised with regards to the PSNI, that I could communicate those directly to Inspector Michael O'Lone. I've done that now on a number of issues, and I've done it specifically around the Tesco issue because I have no doubt, having watched the video, that the gentleman in question was assaulted by a police officer whose number I passed on. If this is the kind of attitude that the PSNI are going to have with something that everyone is struggling with at the minute, and are willing to do it in front of people's families, then we really do need to look at where we're at. And I'll certainly be in no fear of condemning the actions of the PSNI when it comes to this ridiculous methodology that they seem to have, which is to effectively jump the gun, for lack of a better term, and seek to manhandle members of this community and ask questions later. And it's a responsibility of their leadership to ensure that an example is set. And obviously, they don't seem to be very good at doing that.
Okay, thank you, Councillor Doyle, for that. Alderman Hussey, did you want to come in on this, or what was it?
Not on this particular issue, Chair. It was another issue.
What was it?
The motion that was previously passed, the funding motion.
Yes.
Very briefly, Chair, of course, totally welcoming that, and I've absolutely no doubt when it goes to full council, it will achieve support there as well. And I think it highlights the fact that the community out there need help and need it now. So it's not when do we want? It's not a question of when do we want it. It's when do we actually need it, and it's needed now. Which leads me on to through you, Chair, to ask a question of Karen. Is there any indication of why the Economy Department would be considering the delay in the £200 household vouchers that had been released by the Department of Finance? Again, and I'm very mindful that these things, that bureaucracy, etc., is going to be involved. But I would like to think that an indication has been given out to local authorities. Yes, it may take time for this to be distributed, but we have started the process, and as soon as possible, we will have these available for families to use on our local shops. Thank you, Chair.
Okay, thank you, Alderman Hussey. Councillor Harkin.
Thank you, Chair. Yeah, I wanted to speak to the one prior to Alderman Hussey's comments there. And look, I did read and seen that representatives from a number of parties had spoke about the futility of the recent shootings. And so, I think that was very clear. On what Councillor Donnelly raised, the issue of policing through the COVID crisis has been very worrying. I think it's been clear to a lot of people that the police have been given increased powers. We've now had the policing report, we've had the Ombudsman report about the Black Lives Matter protests, and we haven't had a discussion here at Council about that yet. I don't expect us to have one here. But it's very, very clear that those of us who criticised what happened on June 6th, and Councillor Donnelly and myself were at the protests, that I think we've been vindicated, and that there were people who are at this meeting called for the full weight of the law to be brought down on top of our heads, and the organisers in the BAME community. So the videos that I've seen of people being harassed by the PSNI were very worrying, because I really don't think that there's going to be a law and order solution to the people breaching the pandemic. Big corporations, as everybody knows, were clearly violating the restrictions, and it wasn't until there was an outcry that the executive office spoke out about it. So it's still one law for us, and another law for people who appear to be privileged or powerful. So I think that this is a very serious issue, and I think we have to, there has to be a way for us to send a message that's not acceptable. Thank you.
Okay, thank you, Councillor Harkin. Councillor Raymond Barr, you had contacted me about an item you wanted to bring up under Chairperson's business.
Yes, Chair, thank you. Just before I get to that, Chair, I'll link through the Health and Community Committee to pay respects and offer condolences to the family of the Marion O'Neill, whose body was recovered from the River Foyle on Wednesday, and also to pay tribute to the statutory and non-statutory groups from both sides of the border, plus the huge amount of local volunteers who took part in the search for Mozambique over the previous 6 days. I also like to offer condolences to the family of the late James O'Kane, whose funeral took place earlier today. Next, Chairman of Strabane District Council, a councillor for 32 years. As a councillor, James was hugely respected and popular councillor who worked tirelessly for the people of the town and his role as an independent councillor. The new walkway, the canal, has been an instant hit with locals who are flocking to the area. They enjoy a walk now during the lockdown. The canal, in essence, has become a victim of its own success. However, the age-old problem of dog fouling and dogs not being kept under control has raised its head down here, as well as in other recreational areas of the district. I honestly feel it's time for council to adopt a zero tolerance on this problem. Another issue is the problem of speeding on Park Road. I would propose officers contact the relevant department with a view to maybe imposing the speed limit, or if possible, installing speed ramps. One other question I'd like to ask is, because of the popularity of the canal now, parking has become a major problem. I would presume council owns the car park down there, and if so, is there a possibility of the car park maybe being expanded in the future to cope with the extra demand? Thank you.
Thank you, Councillor Barr. Karen, would you like to come in there and answer Councillor Barr? Or?
Yes, Chair, that's okay. With regard to the canal, it sits within the Environment and Regeneration Directorate, so I'm happy to pass on the comments in regard to the extension of the car park, and certainly we'll take on board liaison the speeding on Park Road. If Seamus is in attendance, maybe he wants to comment just on the dog fouling and dog control.
Yes, we are aware that there has been an increasing number of complaints. Prior to Christmas, we had an internal meeting with a number of different departments, and we've agreed to authorise more council staff to take action in relation to irresponsible dog ownership. Members will be aware that we've introduced more dog control orders. Fouling on lands is one of those orders that we are going to try and reinforce the messaging, and we are going to increase the patrols across the city and district to make sure that we try and keep on top of this problem.
Okay, thank you, Seamus, for that there. Councillor Edwards, would you like to come in there?
Yep, thanks for letting me and Chair, and I'd also like to give our respects and sympathies to Marion's family in Strabane, and also to former independent councillor James O'Kane. Chair, in relation to the issue of dog fouling, and I raised it last night at the Environment and Regeneration Committee, and to be funny, I was told to come to this committee, and now we're being told to go back to the other committee. And have been liaising the last number of weeks, and I know that, as Councillor Barr mentioned there in Strabane, I know it's a big issue in Strabane. It's probably across the entire council area, but I've particularly seen it in the Derry, and I have got a commitment from Street Cleansing, and I've been liaising with them the last few days to come out around Strabane and around Derry to clean up the dog fouling. But we have a massive issue in terms of enforcement, Chair. I don't think enough is being done looking at the figures on fines given out. I've been a councillor 8 months, Chair, and I've yet to see the dog warden in my DA. So when Seamus talks there about taking additional enforcement, I would like to see visibility, especially in my own DA and in Strabane, because I simply don't see it. And we have people coming, like the rest of the councillors there's people coming to me nearly on a daily basis, footpaths covered, and they're asking what council's been doing. And all I can say is council needs to do more, but
I think it is like now's the time for council to do more. And I know the pandemic has probably exacerbated the problem. There's more people out walking, but I think that council ultimately need to be more visible. The dog warden needs to be more visible in the RDAs. Thank you, Chair.
Thank you, Councillor Edwards. Councillor Ferguson.
Thank you, Chair. And again, similar to Councillor Edwards, it's been we've been contacted by a number of people around dogfighting issues, and mainly in the rural areas. One lady in particular was at Lochmore Forest, and her young one fell and obviously was covered. And when they've gone to the Forest Service has said that they don't provide bins. That's down to council. So if Seamus doesn't mind his favourite topic, if I send him across an email, if he could look at possibly, putting more bins in our rural kind of forest areas and making them available for people out enjoying our nature. Thank you.
Thank you, Councillor Ferguson. Councillor Mooney.
Yes, Chair, thanks for letting me in. It's on the issue of dog fighting as well. I just want to lend my support on the previous comments to discuss the waterside DA. I've had a couple of calls since Monday, in particular up around the Seven Oaks area. Now, I did contact the relevant street cleansing section, but I just wanted to reinforce that obviously I had one particular lady who was walking with her child, and she said that she had to navigate a lot of dog fowl in that particular area. I do understand that people are at home because of the new restrictions. People need to get out, but we need to urge dog owners or those irresponsible dog owners to pick up after their pets because it is becoming a very, very, very large issue. But if you just like my comments passed on to the relevant officers. Thank you, Chair.
Thank you, Councillor Mooney. Alderman Devaney.
Chair, for allowing me in, and I agree with the comments in around the canal in Ballymagorry and the parking issue and the speeding issue on Park Road. And look, this was a very, very good project, and it's been a very, very successful project. And look, it's part of that there that's causing the car parking problem. The speeding is something probably that needs to be looked at and addressed as well. The issue in around dog control, look, I've raised this many, many times, and I think one of the councillors said that this was raised yesterday at the ENR. I think it was. I think Karen said that it was the parking was to go back to ENR. I think I can clarify that. Maybe it's the parking sits under ENR, because I clearly have raised this under ENR before, and I told about dogfiling. It has to go to health and communities. But back to the dogfiling, it is a big issue out there, and I know council have passed control orders and this and that. But, at the end of the day, with the volume of people that are out there with dogs now, and there are quite a number, Chair, of very, very responsible dog owners. And we don't want to get them tied in with everything that's going wrong. It's the irresponsible dog owners that we need to be working on here. And I do agree, it would be good if we had more dog filing officers out on patrol and looking at these areas. Thanks, Chair.
Thank you, Alderman Devaney. Councillor Gallagher.
Thank you, Chair, for letting us in. Chair, we've been talking about this and this council since it began 6 years ago, 7 years ago. Dogfighting is a major problem. With this pandemic, it's become a real major problem. Strabane town is covered in dogfighting. And we need to see some action coming from council. We need to see dog wardens will not fix this problem. But dog wardens, if they go out, they will be able to see where there's constant dogfighting. And we need to see signs, and we need to see what we've got, which is temporary cameras going up in Strabane across the hotspots. That will be a temporary solution. We need to look, and this council needs to fully investigate the long-term solution. And I've raised it before in this council. There's the potential around the DNA of dogfowl, and if DNA of dogfowl will eradicate this problem, we need to invest in it. and we need to invest in the future. We need to investigate it and put a business case together, and that's what we need to do. It's worked in other parts of the world, but people are constantly treading on dogfowl through Strabane. It's just got way out of control, and it needs to stop. There are responsible dog owners, no problem, but there are people who are not picking up, and we need to identify them, and they need to stop. And we need to see visible from this council, visible action that's going to address this problem. Thank you, Chair.
Thank you, Councillor Gallagher. Alderman Work.
Thank you. I would agree with Councillor Gallagher, and only today I got a call. A young child put his hand in dog dirt and it's around a play park. Over this pandemic, I think all the councillors and older men have been getting these calls daily now, and over this present time now, it's been a lot worse now. From Mackermissons to Buildings, pardon? From Mackermisson to Buildings now. The question I'd like to ask council officers on this: can we make out like a no dog zone? Now I know the play parks, obviously there are no dogs permitted on it, but see that surrounding area, say like Buildings, the play park area around that. That's where we're having a major problem in Buildings Village with the dog dirt. There's a dog bin there. People even actually bag the dog dirt, but they'll just leave it beside a tree instead of walking 20 meters up. They put it on a bin. But it's a major problem here. But I'd be looking a complete no dog zone around that area, especially beside the play facilities where there's plenty of areas where dog worker or walking can go, so there is. But can we do anything in that, Karen? Definitely, we need to get more dog wardens out there around the communities, around Strabane, around the city, and around our parks, because the paths are absolutely getting stinking now with dog dirt.
Okay, thank you, Alderman Work. And listen, I completely agree with all the previous speakers. We all have been getting calls about this. They seem to have increased tenfold since lockdown. And there is those inconsiderate dog owners out there who just don't care. Will there be more signage? I personally think a few more, as soon as you get a few fines out there, the word will soon get about and people will be a bit more cautious. But then again, it's providing those dog wardens to get out and about. And like even I was contacted yesterday about in the Drumahoe area with dogs actually off the lead in an area where they're not supposed to be in the park. And it's a recurring problem out there, and dogs have attacked dogs who are on leads at the time. So that's another serious problem. But Councillor Barr there has a proposal in the chat box. Do you have a seconder there, Councillor Barr?
Happy to second, Chair. Stephen Edwards.
Okay. Thank you, Councillor Edwards. Has everyone seen it there? Does anyone want to speak in that? Councillor Edwards?
Yep. Chair, thanks very much. Chair, I have the stats for dog fouling across each council area. And what strikes me is that in the last 3 years, Derry and Strabane has, well, this is up to 2020, has got 6 fines for dog fouling. Ards and North Down has got 475, Chair. I think we need to start getting serious about this issue. And I just wanted to add that to the discussion, Chair. Thank you.
Thank you, Councillor Edwards. There's a big difference there now. Members, we have a motion there, or sorry, a proposal on the floor. As I suppose everybody's in complete agreement with that proposal anyway. Or anyone want to speak on it, or he's all happy enough with it?
Chair, happy enough with the proposal. I just would like Karen to answer my question about the no dogs.
Yep. Karen, you come in there.
Chair, I'm just going to defer that to Seamus, if you don't mind.
Yeah, go ahead.
Yeah. Dog exclusion order, which relates to play areas. So the dog should not be in those areas, and we'll follow up with the member in question in relation to any evidence.
Okay, thank you, Seamus, for that. Okay, everyone. I've one more speaker. Everyone, anyway, unanimous on the proposal by Councillor Barr, so it passes. Morris, or Alderman Devaney had contacted me under Chairperson's business as well, so go ahead there, Morris.
Thank you, Chair, for allowing me. I have a couple of wee quick issues to go over here. First of all, Chair, I want to raise concerns. You know, when we read the news that HMRC have named and shamed a number of employers for not paying the minimum wage, and I think this is disgraceful when you look at the number of people, employees affected. Well over 1,000, and when you look at the volumes of money that had to be paid out, that was underpaid, around about £150,000, and you know these are people of very very low wages, and you know at the end of the day, I do welcome the HMRC naming and shaming them and fining them, and you know the messages clearly go out there to all employers that the minimum wage is not optional, it's law. And when you look at the figures, when you look at some of the businesses, and I don't want to name any of them because they're online there for to see, some of them have, have to £43,000, some of them, round, that is scandalous. Chair, and I just wanted noted that I welcome HMRC's initiative on this, and I hope it sends a message out to those employers who are not paying the minimum wage, that they will be scrutinised and be brought to task. The second thing I want to raise quickly, Chair, is in relation to an issue that I raised a while back. It was in relation to after the air ambulance had came in and given their presentation, and I know myself and the party had asked that officers go away, and we looked at a figure, and I had looked at a figure at maybe 10,000 per annum for 3 years, to be reviewed every 3 years, whatever the case may be. Chair, I think it's important that we put this back on the radar again, now that we're going into the rates review and stuff like that there, because, you know, at the end of the day, we talk about all the organisations that are doing well. This is an organisation, a charitable organisation that is saving lives across Northern Ireland and across our council area, and none of us ever know when we need to call on them. And you know, I believe that we have a, you know, in my opinion, I think we should be helping out there. We're helping out in many other charitable causes, and I do believe, Mayor or Chair, that I propose that this be brought back on the agenda again for the rates committee or rates review.
Okay, thank you, Alderman Devaney. Karen, would you like to come in there?
No, happy to pick that up as part of the ongoing discussion regarding rates.
Okay, thank you. No indicated speakers, so we'll move on to item 7, matters arising from open minutes of Health and Community on the Thursday, 10th of December. Does anyone like to speak on matters arising? Councillor Harkin, are you looking on matters arising?
I am, yeah.
Yeah, go ahead there. Go ahead.
Thank you, Chair. So this is in relation to agenda item 7, HC 21620, and we had the deputation by the representative from Unison, and we agreed a number of things at that meeting, and it's pertinent to talk about now after Alderman Devaney's comments about workers not receiving fair pay. So we did agree that we would write in support to Westminster in support of the pay increase demand of healthcare workers, and call for it to be ring fenced. We also agreed that we would write to the Stormont executive, and we also agreed that we would contact all Westminster representatives from here to urge them to support the healthcare workers' call and demand and campaign for a pay increase. I'm wondering if we've had any response back by any of those entities. And I've been trying to keep an eye on Westminster, and I haven't seen any representatives speak up, publicly about the healthcare demand. Is there any updates on any correspondence?
Okay, thank you, Mr. Harkin. Karen?
Chair, members, just to confirm, yes, that a correspondence did issue. We did in the last couple of days, I think, just receive a couple of responses, not in time, obviously, to be tabled for this committee. But we'll send you out a little update note on that, and obviously table then the formal responses for the February committee.
Okay, thank you, Karen. No other indicated speakers there.
Chair, I have another short issue on the. Yeah, thank you. Yeah. So this is in regard to HC 22220, and it was on a similar issue. We had a discussion about taxi drivers that have been driven into poverty because of the failure of Stormont to actually put financial relief schemes in place for workers like taxi drivers. And I know that there's another discussion pending now at the executive again about how to help taxi drivers. And I think, a lot of them are kind of giving up on the idea that there's going to be any financial help for them. We did agree that we would contact a number of ministers about taxi driver poverty. I'm wondering if there's been any correspondence back. I think we asked for a meeting with three of the different ministers that would be involved in trying to develop a plan. Thank you.
Members, just to confirm, the correspondence has issued. I just don't have an updated position on the updates, but we'll check on the responses for you.
Can I just come in?
Thank you, John.
I'd just like to say that the minister actually has announced there today a change in the packages for taxi drivers. There will be a second scheme to apply for. The drivers who lost out over payment holidays at the start will be allowed to reapply, or anyone who hasn't applied the first time will be allowed to apply. It will be taken over a basis of £3,000, and they will be split. And the first one will be with payment holidays, 30-day increments, and each 30 days the driver will lose around, it's expected to be about £250. So in that case, if you had a payment holiday for 2 months, then you would stand to only receive £1,000 from the first package. But if you have no payment break in this one, you will receive the 1,500. So that's my understanding of it, and it was announced today there. Councillor Duffy was looking in there.
Yeah, Chair, you basically covered what I was going to say there, so I don't need to come on. But the executive have backed the minister's plans in terms of the taxi drivers today, so no, it's very welcome.
Thank you, Councillor Duffy. Councillor Farrell.
I was going to say something similar as well about Nicola Mallon's announcement today. So no, that's good news for taxi drivers. They're getting more support now, and the ones that fell through the cracks the last time that didn't have 100% insurance for the qualifying period will get support. So that's positive news coming from the executive.
Okay, thank you, Councillor Farrell. Alderman Hussey.
Thank you for allowing me to come in. It's also on rising from the minutes on page 30, where we were to contact Unison with regard to the future of school meal service. Has there been any comeback from Unison on
that? Karen, you like to come in there?
No, not at this point, members.
Okay, thank you, Karen. Let's see. Councillor Edwards.
Chair, thanks for letting me in. I think it was a few meetings ago I raised the connectivity, mobile phone connectivity in the Castletown area of Strabane, and it's actually got worse now, and I've been receiving emails and Facebook messages from constituents asking if there's any update. I've written to them myself, but I know the council has as well, Chair. I'm just wondering if there are any updates on that, Chair. Thank you.
Karen, any updates on that?
And members, we passed that query to Kevin O'Connor in the business section, who's dealing with all of the connectivity issues. So we'll double check, Councillor, and get you out an update from him.
Councillor Harkin.
Yeah, thanks, Alderman Hussey, for raising the issue. I'm a Unison member, as people know. There is a campaign here in the north that is for a universal free school meals, which would not be based on household income. There is a campaign, people may have seen it, some banners going up, but that will be done systematically very soon, hopefully right across the north in all communities, and I'm hoping this campaign, and as the organisers are hoping that it's broadly supported. I think there's any number of arguments and reasons why every child having access to a very good meal at the centre of the day will help them in all sorts of ways. So that there is a campaign to that end, and I hope that all the parties and that the council will back the campaign. We could agree to do that today, but there will be more information going forward about this campaign. I think it's a very important one. We all know the difficulties people are facing in terms of poverty and putting food on the table. And there's all sorts of issues with shaming in terms of some children accessing free school meals because their parents, are on a certain wage level, and then some children whose parents are barely above the threshold for free school meals now, but have to go into school sometimes without the money that they need to pay for their meals. So this would eliminate that, and it would make it a right for every child, be outside of the pandemic, to have access to a meal every day of the week. The Scottish Government has just agreed, they've brought forward a white paper now that will deliver a breakfast and a lunch to every child going to school, which I think is fantastic. I think we should attempt to emulate that here. I think that this will be something very much that would be worth paying for from the executive and finding the money for. But I hope that this is something that we can all get behind.
Okay, thank you, Councillor Harkin. You wanted to respond there, Alderman Hussey?
Just very quickly, I thank Councillor Harkin for that input. And I suppose as one going back years when the colour of your dinner ticket indicated a certain status, etc., is something that needs to be got rid of. And the Universal School Meals campaign would be welcome. I think there is a responsibility when our young people do come into school to ensure that they have a good meal, and that not alone just the morning, but that they're in a fit state to carry on their schoolwork in the afternoon. So I thank Councillor Harkin for that update. But I suppose no harm to Councillor Harkin. I would still like the official response from Unison themselves, taking all on board what Councillor Harkin said.
Okay, Alderman Hussey. Councillor Farrell.
Thanks, Chair. It's regarding item 223. So it's the infamous mobile masts at Glengala Road and Strand Road. So just a question to Seamus. Have they been tested yet?
Through you, Chair, we've raised an order in relation to the Strand Road site, which council will pay, and I think it costs £1,000. And a local school has been asked or has contacted Ofcom to carry out an assessment of the Glengalia Road mast. We haven't had any of the audit reports received to date, but once we do, we'll update members.
Okay, thank you, Seamus. Thank you.
Folks, no other indicated speakers, so we'll move on to item 8, draft mental health strategy consultation document. And Seamus, if you'd like to take that.
Yes, Chair, thank you. Members, the Minister for Health published a Mental Health Action Plan in May 2020, which included an action to produce a new mental health strategy for Northern Ireland. The Department of Health is now consulting on this draft 10-year mental health strategy, which contains 29 actions which aim to improve mental health outcomes in Northern Ireland. And members, you're asked to consider the draft strategy consultation document, and a draft response incorporating your views will be prepared for consideration at a future committee meeting prior to submitting to the Department of Health on the 26th of March.
Okay, Seamus. Thank you for that. Short and sweet. I have a number of indicated speakers in this. First of all, Councillor Doyle.
Thank you, Chair. Just before I get onto this, I want to echo what, as a unison member, exactly what Councillor Harkin had mentioned with regards to school meals. Just in relation to this, I suppose as a point of information, I have submitted a motion for full council about the mental health strategy. I know that in the recommendations here, it'll be that our views will be collated. Part of the motion is to bring people, all the parties and independents together to very much look in depth at specifically what this strategy means for the city and district. I think it's one of the most important documents in terms of consultation that has come out in years. We know obviously that there are massive areas with regards to mental health provision that require attention. So it's really just for information, and hopefully that will pass at full council, Seamus, and that might give you some scope in terms of going forward. Thank you, Chair.
Thank you, Councillor Doyle. Councillor Farrell.
Yeah, thanks, Chair. We in the SDLP think there's a very honest assessment of the state of our mental health services across the north. Unfortunately, it paints a sorry picture of the existing provision, but there are ambitious plans to address the failings. The SDLP is in broad agreement with the actions outlined, but the real test is going to be about delivery. We could paper the Guildhall inside and out with strategies, action plans, position papers and independent reviews that have amounted to nothing because they weren't given political priority, they weren't given adequate resources or funding. The North has the highest rate of mental health problems in the UK, but has the lowest rate of funding. Here in the Western Trust, we've got massive waiting lists because demand outstrips supply. We aren't seeing enough social workers, we aren't seeing enough mental health nurses, we aren't seeing enough clinical psychologists. Vacancies exist everywhere, and we've mentioned waiting lists previously in this chamber, and we've written to the Western Trust and we've written to the Department of Health. But fair play to the Western Trust, they're transparent about things. If you look on their website, you can see the clear data and the statistics about mental health waiting lists. When you look at other trusts, trying to find sort of comparable data is like trying to find a needle in a very hard to locate haystack. So we welcome the commitment within the strategy about regional oversight and about performance monitoring. We also welcome the commitment about a regional crisis service. So we won't have this constant funding battle to sustain our own local crisis intervention service. But the real test is going to be, does this work? Only 40% of people with mental health problems in the North were able to access effective healthcare. And 80% of people who sought treatment felt that the service they received is not what they needed. I'm going to make one final remark, Chair. At November's council meeting, I raised mental health lists. One person in the Western Trust was waiting 171 weeks to access psychological therapies. I've looked at more recent data and they're still waiting. They're waiting nearly 3.5 years to access psychological therapies. So the test of this strategy and its implementation is going to be, one, can people access services in a timely manner and they won't have to wait 3.5 years? And two, when they do access services, will it be the right service that makes an actual difference to their life? Thank you.
Thank you, Councillor Farrell. Councillor Burke.
Thanks, Chair, for letting me on. So we definitely welcome the progress in producing an effective mental health strategy for the North and would like to commend the work done they did on the draft. There's nothing really within it that I could disagree with in terms of where we're at in regards to the current state of mental health within the North. There's no doubt we're all aware of the serious threat and issues around mental health. As the previous speaker stated, it's a topic that's been discussed in our chamber many of the times. And despite the tremendous effort of workers within all areas of mental health, the service has been lacking and has been for a long time. I'm sure everyone here can give accounts of negative experiences people have had when seeking help, be it between the wait times or accessing appropriate services, including crisis support. And as a council, we're well aware of the need for a sustainable crisis support service, and it's something that we have been fighting for the past number of years. And while we all know that these problems well outdid the pandemic, there is no doubt the current COVID health crisis will add massively to what was already a highly sought after and on-demand service, and will likely have an impact for years to come. We know mental health is an issue that requires immediate attention. And I think with this draft, the joint up approach they produced in the draft, including the cross-departmental and cross-sectoral engagement, and now obviously the public element of the consultation, hopefully should allow a full picture of the issues and where they're at, but more importantly, allow for a broader sort of joint up discussion and approach, and then ideas and solutions to tackling the issues. Mental health for too long has been neglected, and the draft and then the following strategy is an opportunity to shape a structured, practical and effective solution to both address and deal with the issues that are impacting massively in our communities. And I imagine everyone within the chamber will want to have their say, and as a party we will be forwarding our response in due time. So thanks, Chair.
Thank you, Councillor Burke. Councillor Ferguson.
Thank you, Chair, and thank you, Seamus, for the report. I'm happy to forward on my points to Seamus directly for the consultation. Obviously, I welcome the report, and it's much needed in a way of producing an action plan and a strategy moving forward, especially the regional crisis service. I just think that there's a few gaps that we could do, like Councillor Burke had said, the joint up approach where we can see the likes of our crisis center being able to take the pressure off our A&E departments, and then also within our schools having a trauma-informed strategy with the schools themselves. Plus, there's also a 10% increase to CAMS, which is very much welcomed and is needed because the CAM service is really struggling. But when we had CAMS within our committee itself, it wasn't necessarily the funding that they were struggling with, it was actual bodies and the people having the positions filled. So I'll not labour too long on it, as say, because many people want to speak on this issue because it is very dear and near to many of our hearts. So if you don't mind, Seamus, I just want to check when would be the latest that you could have any responses back to yourself. Thank you.
Through you, Chair, I suppose the response needs to be in by the 26th of March. So in an ideal scenario, I'd be able to bring a report back to the February committee, but it's unlikely that timescale will be met. So I suppose if we aim for the mid-February to try and get responses pulled together, and if we don't make February committee, we'll at least have it in for the March committee.
Okay, thank you, Davis. Alderman Devaney.
you, Chair, for allowing me in, and I just want to echo what everyone else has said. It's very welcome to see this strategy coming forward, and it does give a stark picture of provision for mental health across Northern Ireland. And when you look at Northern Ireland, as previous speakers have said, one of the highest numbers of mental health issues in the whole of the United Kingdom. And I do believe, when we look at the issue here, it's about getting the mechanism right and the delivery of that service and the right service that everyone can get to. And I know I've said this often before, I know our numbers are high, but there are a silent number of people out there, and I'm sure we don't have numbers for that no one knows about. And it's about getting the message out there, Chairman, and the right message is that if you do have mental health issues, please come forward, that there's help there for you. And I think that is the most important issue. Thank you, Chair. Very happy to support it.
Okay, thank you. Could I have a proposer and seconder for this? Just whenever you're here.
Chair, can I come on?
Chair Morris?
Yeah.
Or I'll second it, whichever.
Okay. Yeah, go ahead, Councillor Donnelly. I just wanted to get that proposed and second before you come in.
No problem. Chair, look, I think one of the words that's sort of used, very often used, is the word crisis. There's absolutely no doubt that there is a huge crisis regarding mental health. We talk about strategies. I don't see a strategy, and I'm basing that on dealing with people on a daily basis. I'm sure as every other councillor is, Chair. And I'm dealing with one young lad who has become homeless, and in order to get a full duty applicant status, he needed a letter from his mental health team, and that young man, Chair, has been trying for the last fortnight to get through, and he's having absolutely he hasn't even got a roof over his head. So it's not about him even getting the help to get his issues sorted out. He can't even get a letter from the team at his GP for the last 2 weeks, let alone get help for his mental health problems. And as a result of that, he isn't even given homeless status. Look, whatever it needs to be, I think there's a massive onus here on all of us and all parties to try and get something together to get this addressed, because it seems to be spiraling out of control. Thank you.
Thank you, Councillor Donnelly, for that. Could I have a seconder for that, just?
Happy to
I'll second it, Darren Rory.
Okay, yeah, no bar. Folks, that's everyone thing need to speak there. Okay, I always have to say mental health traditionally is the poor relative of the NHS, and in the past it's been continually underfunded. So we just hope with this here consultation document that it finally gets the attention it deserves. Listen, folks, we're going to take a small comfort break here for 10 minutes, if that suits everybody, just to sort of stretch your legs there. So we'll see you back here at 5 to 7. Okay, members, is everyone back online again? We all members back? Yeah. Yes, no. Everyone back? Okay, folks. Members will crack on here with item number 9. Foilside Community Resilience Fund underspend. And Barry, is Barry here?
Yes, Chair.
Yep, Barry, take it away there.
Thanks, Chair. Members, the purpose of this report is to seek your approval for the reprofiling of £7,061.75p from the Foilside Community Resilience Plan. Members, you'll see the detail in the report there, the reasons that there's been an underspend. It's not an additional ask from Council, it's just about reprofiling in the section. You'll see the proposed spend around section 3.3. So we're seeking your approval to reprofile this within the Foilside Community Recovery Plan. Thanks, Chair.
Okay, Barry, thank you. See, Patricia, you want to come on there?
Yeah, thank you, Chair. Thank you, Barry. Yes, I would just like to propose that we accept this recommendation to shift the underspend, the spend about. I suppose these groups know where the money is best spent, and it shouldn't be left. It shouldn't be lost by any DEA. So I would certainly recommend that the report be implemented. Thank you.
Okay. Thank you for that. Seconder, can we have a seconder for that?
Happy to second, Chair Rachel.
Okay. We'll move on there to item 10, playing pitch strategy. Barry again.
Thanks, Chair. Members, the purpose of this report is to provide you with options for approval around delivering our strategic recommendations for our playing pitch strategy, and to seek your approval of our draft priority scoring matrix to be used for all projects under any preferred options. Members, I must caveat this by saying there'll be much more detailed reports over time that will go to the Capital Working Group and then into Governance Committee and full Council, obviously, but this is to give a high-level overarching view of what our playing pitch strategy is recommending and how we see that going forward. So, members, we've discussed this over a number of meetings over the last number of years, and there was a recent October 2020 update provided to members, and hence why we've brought a more detailed piece of work in here in front of you this evening. The officer team have actually developed this based on what the consultancy team provided us in terms of the strategy. And just for information, members, you'll see in section 2.6 that the strategy is currently out for a 12-week public consultation. The final report around that consultation will be presented for your information, members. You'll also be aware previously we have 6 key strategic recommendations within the playing pitch strategy. And what we're suggesting is to ensure that these recommendations are delivered. Officers are presented members with a list of options in the appendices, and these have been categorised as protect, enhance and provide, and you'll see the narrative, members, in the appendices how we're going to do that. Look, we've already started work on a number of those. A previous report was in terms of grounds maintenance works and other works around change of pavilions, and that will be within the protect section. But enhance and provide obviously is new facilities and further improving the offering that we currently have. So you'll see that all outlined in sections 3.3 to 3.6. For all of the options, members, the relevant recommendations are listed with a score provided for anticipated overall impact in addressing identified need from the playing pitch strategy. And this impact score ranges from 4, which is significant, to 1, which is minimal to no impact. All costs at present, members, are indicative, are based on standard construction costs. Costings that are more accurate would only be available at design scheme stage. So when we do bring this forward and get an agreed action plan through capital working group members, we would appoint design teams, for example, for major capital projects or major refurb works. Due to the likely availability of resources, it is clear framework to prioritise any project under any preferred option as required. And you'll see, members, the draft priority scoring matrix also within your appendices. It's worth noting, members, that there's currently no budget for any additional spend. There's one exception to that, and you'll remember the report that was brought in December about possible leisure underspend. So we've had a number of meetings with our property team, and we will be carrying out substantive works around our grounds maintenance and pavilions over the next number of months, members. And also advice has been sought from the Equality Officer with regards to the specific equality impact screening to be undertaken in relation to the strategy and the requirements of the Rural Needs Act. So, members, in terms of the recommendations, that you approve the preferred options to deliver on the playing pitch strategy, and that members approve the draft priority scoring matrix to be used for all projects under any preferred options. Thank you, Chair.
Okay, thank you, Barry, for that there. I have no indicated speakers. Could I have a proposer and seconder for that? Alderman Hussey, come on here.
Thank you for permission to come in on this, and thank you, Barry, for presenting it. If I can look at page 49, clearly identifies where the deficit is, that there is a pitch deficit in Strabane Town, Strabane Rural, significant compared to Derry City, Derry Rural. But when I look at the proposals going forward, I don't see anything that says be there. Maybe I've missed it. Barry can come back to me on it, where new pitch development is included. And I welcome the fact that this report, as Barry says, has been sitting there for a long time. And, you know, the section on page 50, which shows us clearly that we as a council area do not have a surplus supply comparative with other councils. We're falling very, very far behind other councils on those particular issues. So when you look at the strategic recommendation, I welcome the fact that the project, the strategic involvement was not just council, but was local sports clubs. But it's still within the overall cognizance of our council and our sports club provisions. Where the deficit exists has been identified. It is disappointing that that deficit also corresponds to play park provision deficit. And it's disappointing when Barry said, look, there's no budget to deal with this. But certainly I know that I and others will be looking at this when we come to look at the rates. And it is something that has to be addressed. It has been clearly identified now in two reports, the deficit in play facility, pitch facility within the wider rural area. And I trust that members will be aware of that and be mindful of these reports when we come to deal with the rate situation going forward. As I say, I thank Barry for the report. There's a lot of good in it, and I'm sorry if I'm just looking at the black spot on the white page, but those issues have to be dealt with within any strategy going forward. Thank you, Chair.
Thank you, Alderman Hussey. Councillor McHugh.
Thank you, Chair, and just want to endorse the comments of the previous speakers, Councillor Hussey. He's quite right. We've had a number of reports, and I don't know how many times we've had the draft playing pitch strategy brought to numerous committees, and here we have it yet again. But it's time now that we need to endorse the recommendations, and I'm happy to propose or second the recommendations if Councillor Hussey has not already done so. But it's quite.
I'm not a member of the committee, right?
Well, I'll propose it then. He's quite right. That's what the rates process is there for, and the deficit of playing pitches identified within the report is something that's having a knock-on effect as well in terms of existing clubs being hampered and developing their own codes. So as I say, I welcome the report. I look forward to working on it and contributing to the outworkings of it. But as I say, it's time we need to start doing the work that's recommended within it. So let's provide the necessary financial ask and get down to work on it. Thank you, Chair.
Thank you, Councillor McHugh. Councillor Mooney.
Yes, Chair, happy to second the proposal from Councillor Councillor McHugh.
Yep.
Can you hear me, Chair?
Yep.
That's grand. I've read the report in full as well, and I do endorse the comments from Alderman Hussey and from Councillor McHugh as well. It's a detailed report, and it seems there are 143 pitches in stock around our city and district area, but there's gaps that have been highlighted by the previous speakers, and I would endorse the recommendations at 5.1 and 5.2, and look forward to receipt of the full report in due course, and echo comments and saying that we have to take these matters forward as best we can. So thank you, Chair. That's all I have to say in this. Thanks.
Councillor Mooney, thank you. Councillor Alderman Devaney.
Chair, for allowing me in, and like the previous speakers, I welcome the presentation coming forward here, and I do agree with the rest of the speakers that there are deficits here and gaps, and it's an issue, as someone else has just said, for these smaller clubs to grow and mature. And when you look at the logos, protect, enhance and provide, how can we do this, Chair, if we don't have a budget? And I do believe it needs to be put into consideration now for the rates estimate if we're going to deal and deliver on this and protect, enhance and provide. But welcome it coming forward.
Okay, thank you, Alderman Devaney. I've no other indicated speakers. So we'll move on.
Through yourself, Chair, just if I could just answer all of the queries, particularly Alderman Hussey. If you see, particularly for rural Strabane area members, you'll be aware that in terms of what we've been talking about in the deficit across a number of sports, that 3G facility of some type, full-size GA with soccer going across it, like we see at Melbourne, would address that deficit. You'll see in the appendices address the deficit issues identified through the council area. So there's a bit of narrative around that. Karen and myself have probably explored that over recent years. Is there possible funding from Sport NI or from other bodies, be it rural development? Obviously, COVID has kicked in, and that there's not capital monies forthcoming at present, but the intention would be that would be the number one capital priority project as such. And members will be aware at the last report we're going to try and do elements around protect and as well, in terms of developing facilities at Spanmount and putting council investment to try and address the deficit in some way. We know it's not going to achieve the strategic recommendations, but that would certainly be the main priority capital project for rural Strabane. I don't think that's a secret to members that that's the only way we're going to address that, but there's complexity around that. We need to get a project started, we need a design team, we need scoping out sites and things like that. So that would be one of the number one priorities around that provide area. So I think that answers most of Alderman Hussey's question and the other members in terms of where we're at. So until we actually know what the cost will be, it's difficult what we'll be actually asking council or other funding bodies. The first steps on that road would probably be to get monies for design team members. Thank you, Chair.
Okay, Barry, thank you.
Chair, very briefly, can I thank Barry for that? But at the same time, I'm still waiting on the first shovel digging into the sod.
Okay, thank you, Alderman Hussey. Go on to item 11, Department of Justice consultation on legal protections for victims of domestic abuse. Barry, again there.
Thanks, Chair. Members, the purpose of this report is to seek your approval of a draft response the DOJ's consultation on enhancing legal protection for victims of domestic abuse. Members, you approve the draft response to the consultation and outlined in Appendix 1, and that's a recommendation, members. Thank you, Chair.
Okay, Barry, thank you for that. Councillor Ferguson wanted to come in there.
Thank you, Chair, and thank you, Barry. I looked through the consultation. I'm happy to propose it. When going through it, the figures are stark for our city and district. 801 domestic abuse incidents reported, and 407 crimes recorded since between April and September 2020. I also noted that there was, I think it's 1,616 recorded in a 6-month period. So I think there's a lot to be done, and I think we are right in the sense of proposing that we become one of the geographical locations that will pilot the scheme itself. But if I was to go off slightly away from the consultation itself, I wanted to ask if council officers, during reading this, I'd been contacted through Nexus, mainly about the trying to access rural areas. When it comes to domestic violence, we're seeing an increase of it, but they're not being reported. Also, there's an app in Mid and Antrim Council which is called Here to Help that highlights all the different areas, because I can see in the report, obviously, Musticlair, I'm a member of La Dolce Vita project, but we have a number of sources that people can try and access help and support, but not necessarily know about it. Where this app, you go in and you can either say immediately that you are in need of help right now, or you're considering help, and it liaises with all those departments and those different charities. So just on the basis of proposing the consultation, I was hoping if officers would look into the app that Antrim Council have, and maybe possibly rolling it out so it's for our council area and DEA. Thank you.
Thank you, Councillor Ferguson. Barry, do you want to come on? You know what? I'll just go. No, Councillor Mooney next there.
Yes, Chair, happy to second Councillor Ferguson's proposal there. And again, I've read the report as well, and I do agree with the contents of it. It is a sort of criminal justice centred report because it deals with criminal justice and domestic violence. I do agree with the proposals for the DAPNs and the DAPOs, and I would endorse this report going forward to the Department of Justice. Thank you, Chair.
Thank you. Councillor Logue.
Thank you, Chair. Certainly welcome this consultation coming on. There's just, I would like to direct the committee to the answer on question 6 there, and I was just wondering if we could please include community restorative justice. There is local groups within the DEAs who would have who would deal with community safety. So I do think it would merit if information, if they were included in this too as well. And I do think that maybe head teachers, there's often children in the midst of domestic violence, and they would certainly see the impacts within their schools. So I do think that head teachers should be included in this as well, and the Dolce Vita project. So that's a number of groups that I have mentioned here, and individuals, and I do think that they should be included. Sorry, Chair, if you just bear with me here, I had something written down for question 17. And if I just can't get it here, look, I'll put it under the chat. I think it was, do you agree that the court should be able to vary or discharge domestic abuse protection orders, either for their own violation or the request of the victim or the perpetrator? Look, I'll put it on the chat what I was looking at there, because I don't want to hold this committee up for much longer, but just to go on to question 32 and the pilot areas, while we did say that in question 21 that, you know, we have a very high incidence of domestic abuse, and we do know a lot of that goes unreported as we are in a large rural area too within our council district. I do think question 22 is actually mentioning Belfast and a one rural area. So I do think that while our answer said that we strongly believe that our council area should be located, you know, I think we should, we've ticked yes in the box, and I don't know if that should be no to the actual question, and then maybe if the officer could just give me a response on that, please. Question 22.
Sorry, or through yourself, I don't, Councillor Logue, I don't have the detail around any of that. So I suppose, like one of the previous consultations, if members have comments on this, we can make sure that the team that's compiling this within PCSP reflect members' views on this and make sure that it goes into any response. I wouldn't have, or Karen wouldn't have detail around any of those specific questions.
Mm-hmm. Right. What I'll do then, I will compile a wee summary of all what I have outlined here, and I'll forward it to yourself and Karen, and you can give it to whoever. I know there was a lot on that, and that's a wee bit confusing, but I'll do a wee summary later on tonight and forward it on to yourselves. Okay.
That's fine, Councillor Logue. And any other members, if there's any of the comments,
Thank
fine, you can feed those into the response, Chair.
Okay, thank you very much, Chair. Thank you.
Thank you, Patricia. Alderman Devaney.
Thank you, Chair, and the DP has no problem in supporting the draft response to the consultation. It really highlights the issue here, so it does. You know, victims of domestic abuse, whether they're male or female victims out there, and the numbers are high. And I would say, listening to media and stuff like that there, with the COVID situation, it has exacerbated that whole victims of domestic abuse, and numbers are only going to get higher. And just welcome the recommendation here, and as I say, any help to help victims of domestic abuse or violence is very welcome, Chair.
Okay, thank you, Alderman Devaney. I have no more indicated speakers on that. I'd just like to add my support to the consultation, and definitely some family members suffered from coercive abuse at the hands of their partner. It's not nice to witness, and with family members feeling helpless, we just hope that when this is taken forward, that it will be able to protect victims from that sort of domestic abuse. Members, will go on to item 12, Brook Park Bowling Pavilion.
Thanks, Chair. Members, this is a further update following our last committee meeting, and it's the purpose of the report is to outline for you the options in respect of Brook Park Bowling Pavilion and update members on further proposed consultation that officers will carry out with the bowling club and the governing body and with elected members from the DEA. Members, you'll be aware of the particular issues around the pavilion and new proposals that was brought to previous committees. Just for information, the bowling club has approximately 20 to 25 members, and they play both recreational and competitive bowls. And the club participates in the Provincial Bowling League and the 2 senior divisions. And their home matches are facilitated through the season with the away teams visiting our greens and using the pavilion where we have in Brook Park and similar in Waterside. And for information, members, there is a previously approved sum of £60,000 towards work at Brook Park Bowling Club. We've spoke to the lead finance officer, and that can be carried into any project and any particular proposal that members adopt. Also highlighted in the report there, members, around a traffic management report up at Brook Park, and that has highlighted a number of safety concerns due to congestion at peak times and the lack of parking spaces, and we will be progressing that up at Brook Park in the coming months as well. the current change of facilities that we have, members, for our pitches, both 3G and grass, don't meet the current needs. They're within in the main leisure centre, and they don't meet the needs of the users. 3 options that we discussed, members, at the last committee have been put forward regarding the pavilion. You'll see those options, members: refurbishment of the existing pavilion, a replacement prefab building, which will cost somewhere in the region of 200,000, and option 3, which is a new permanent structure to facilitate the bowling club and enhance change of facilities for other sports clubs, together with infrastructure development to improve traffic management and parking facilities. A number of meetings have taken place with the leisure team and the bowling club members. Bowling club members have been quite clear to officers that they do not want council to consider options 1 and 2, and they only want us to consider a new permanent building. I've highlighted there, in terms of the 25 members of the club, we probably generate about 850 per annum from the bowling operation. So, members, it's recommended that officers organise a final consultation exercise with the bowling club members and with elected members from the DEA. At this meeting, officers from the Capital Working Group will also be in attendance, outlining the stages involved in getting a project on the Capital Working Group agenda, the projected timescales and resources involved, and the business case and capital development requirements. At this meeting with the bowling club, the risks involved in this approach and timescales will be highlighted to the bowling club members. Members will be aware of the number of capital projects that have been approved and identified as a priority, but there's currently no money for. We've had a previous discussion on pitches and pitches deficit right across the district, which we currently have no budget for either, member. So we will highlight that to the bowling club members in terms of the risks of the timescale being further extended going on to the Capital Working Group. A detailed business case will also have to be developed for council in order to agree any funding for a project of this scale. An increase in the revenue budget, in addition to the capital, will have to be provided for any such building, which will have to be found from a combination of rates monies and additional revenue generated from the bowling club. Again, this will be highlighted to the club. We're also going to work with the governing bodies members to see what their priorities are, and can they assist in any way of identifying possible revenue funding. So, members, in terms of the recommendations, that members endorse the proposed consultation process with the bowling club and also the governing body of sport, and that members note the proposed options as set out in section 3 above. Thank you, Chair.
Okay, Barry, thank you for that. Councillor Harkin.
Thanks, Chair, for letting me in there. Yeah, thank you to Barry and the officers for putting together the report, and I think that very much reflects, our previous discussions and the kind of the spirit or the will or the proposals that are coming from the club members themselves. So I do think that engagement that's included in the proposal there is very, very important. That the club members get to engage with council officers, planners, and I think that they were eager to engage not just with councillors in the DEA, but also invite councillors from across the district who have an interest in the bowling club, because it's certainly the case that people from across the district can benefit and use the bowling green. A couple of things to point out that are included there, that about just on the use. I mean, I think that given all our discussions about physical health, mental health, well-being, that this is an activity that I think young people, old people, men, women, children can all engage in and be encouraged to participate in. And I think that that's something that the club members are eager to do. They want to see this, the bowling green used by people in the local community, but also much broader. And so I think that we have to have that kind of vision for how this can be a transformative event in terms of the upgrade of the bowling green. So they want to have an expanded membership. I would encourage everybody here to think about joining. I've certainly begun to consider it myself. You know, we can think about programs for schools to utilise the bowling green. If they have a new facility, it can be opened up all year round, which would be another massive benefit. So you get indoor and outdoor. I think that's what they're hoping for, and clearly there's you know, there could be the issue of changing rooms for Brook Park in general has been an ongoing one, and there's a possibility of cross fertilization there in terms of how changing rooms could be used for other activities. And the issue that Barry mentioned there about the parking, I mean, that is something that has to be resolved anyway. That is a huge headache in the area already, that has been the source of a lot of frustration for the workers at Brook Park, but also residents, and also indeed people who are coming to utilise all the facilities that exist there. So,
Councillor Harkin, you bring your...
Yeah, I'll bring me. I think that the club members have made it very, very clear that they want a new build. So I think that you know, we have to go and have that discussion with them, and then do, as Barry said, everything we can to try and facilitate it, looking for funding from you know, diverse sources. So I don't often recommend reports. I'll be happy to do that at some point in the discussion when people get their points made on it.
Okay, thank you, Councillor Harkin. Councillor Carr.
Thanks, Chair, for letting me in. I'm not a member of this committee. Seeing the recommendation that there's another meeting held with the club, should we not be just, no, I can't propose it now, but if I could, I would. Should we just not be deferring this item now until such meeting takes place to discuss the whole issue in full after, which is a recommendation that a future meeting takes place with the club and members of the DEA? So should we not be just deferring this now, Chair, until such discussions take place?
That's the understanding I would be under after Barry's was talking about it there. That's what I would think as well.
Yeah, unfortunately, I can't propose that, but Chair, but that would be my thoughts. That we go and have this meeting and then come back and discuss it thoroughly. Yeah. Thank you, Chair.
I do think we've talked about this subject that much there in the last meeting, and I think now it should be left until there is a meeting between the council and the members. Councillor Donnelly.
Chair, thank you. And you know, a lot of what needed to be said has already been said about the club. You know, it is intergenerational. It's very much cross community and the social aspect of it, Chair. So, but one issue of the report that I would have, Chair, again, I'm not a member of the committee, but it says 3.9 members, and with bowling club members and elected members from the DEA. Chair, it's my opinion that it should be any elected members who wish to go. You know, I couldn't see a situation where there was a meeting about the Ryan McBride Stadium or Templemore Sports Complex where that would be limited the members from the DEA, which it's in. You know, this is very much a club. It's actually on the border of two different DEAs, but you know, I think that should be open to elected members who wish to attend. Thank you, Chair.
Thank you, Councillor Donnelly. I totally agree. I'd hope to get actually meeting with members of it before Christmas, but I wasn't able to drive at the time, so I hope to get chatting to them before this meeting comes around. Let's see here now. Councillor Mooney.
Yes, Chair, thank you. I'd just like to endorse the views that were said previously in relation to the officer's report. Councillor Donnelly had gone before me there, obviously. It was my understanding that we agreed to that point at last month's full council that all members would be allowed to participate within this discussion. But if my memory serves me right, that is. But I just maybe seek some clarity on that. I thought that was raised at December's full council. and it was agreed that all members would be able to participate within these discussions about Brook Park, but that can be checked. Maybe I've got it wrong, but my memory is sort of going down that road anyway. But apart from that, I would agree with Councillor Harkin and with the previous speakers in relation to what's been said so far. I think probably primarily is we need to have a complete discussion with the members and officers and whoever wants to attend, and they explore the way forward upon that basis and upon the clarity that we see from that meeting, and take it forward from there. Thank you, Chair.
Thank you, Councillor Mooney. Councillor Gallagher.
Thank you, Chair, for letting us in. And as you said, this has been well discussed at the previous meeting. But I think that and I thank Barry for bringing this report forward, because I think this report is more like an update of the discussion and providing options and defining recommendations as the sensible way of going. Consult with the users and have a broad meeting. I agree with Councillor Dominey that this should include any councillor that wants to attend. So I think this is the sensible way that will work out all the difficulties that have arisen, and we will come to a sensible conclusion on this. So thank you.
Thank you, Councillor Gallagher. No more indicated speakers. Proposed Councillor Duffy, seconded Councillor Harkin. So we will move on now. Thank you, everyone, for that. Just one other question.
Sorry, Darren, Chair, so it will be changed then, so that it'll be an invitation to all councillors.
That's what I was just going to ask. Yeah. Karen, was it changed at the full council meeting the last time that everyone could attend?
That's my memory, Chair.
I think Councillor Mooney's right on that.
Members, I checked the minutes, but if the wish of committee is that we involve and open the consultation to all members, we have no difficulty as officers with that.
Okay. All right. Thank you, Karen. Thank you, Councillor Harkin. Okay. We'll go on to open for information. Item 13. NI Executive Support Programs, Warm, Well and Connected. Volunteering Programme update. Barry, do you want to take us through that?
No, Chair, just through yourself, it's the items for information. The Director had presented a lot of that information at full council due to the timescales that we faced. Look, I'm happy to answer any questions and queries on it. It was obviously extremely tight, getting letters of offer and getting money out in the ground, but there's a lot of detail in the report there. It's just to update you further on the scheme. So look, happy to answer any questions on it if members want any queries.
Okay, Alderman Hussey.
Thank you, Chair. And as Barry says, the report was before full council. Just a quick one. Declared interest, by the way, as a member of Derry Community Growth Partnership. On 3.4, Barry, Strabane Community Project extend the service provided within Strabane Town to the neighbouring rural DEAs of Spurn and Derry. I'm given to understand that there were some teething problems with that. Are you aware of those, and were they sorted? Thank you.
Through yourself, Chair, Alderman Hussey, yes, I am aware that there were some issues, resource issues. If this is the same issue we're talking about, and they were resolved, unless there's been further issues. But yeah, there were a number of teething problems, but it's my understanding now that those have been resolved.
Thank you, Chair.
Okay, thank you. All right, thank you. Items 14 and 15. Karen, are we all okay with them? Just to move along. Anyone want to speak on them? Members happy to go on the confidential then?
Proposed, Chair, that we go on to confidential.
Happy second, Chair.
Okay. are we